Yes, sir, it is recording.
Okay. So, when I speak the stimulation, there are two types of stimulation. One is deep brain stimulation and one is non-invasive brain stimulation.
Ada dua macam stimulasi otak, yaitu yang invasif dan yang non-invasif.
Non-invasive means cutting the brain and putting the stimulator inside.
Yang invasif adalah membuka otak dan menaruh stimulator di dalamnya.
And one is non-invasive.
Dan yang satunya adalah non-invasif.
Non-invasive means non-surgical.
Non-invasif berarti tanpa bedah.
Yeah. Non-surgical means just doing it superficially.
Tanpa bedah berarti melakukan hanya di permukaan.
Very correct. Muktahan means superficial, na? Did you understand what is the meaning of superficial, Agush?
Yes, just
on the surface, from the surface.
Under surface, yes.
And the most important part is that whatever is the brain damage, you can recover. If the brain is damaged by 70%, 70%, that is 70%. Even then, you can recover the brain gradually and slowly, and you can bring life back to the patient.
Kerusakan pada otak hingga 70% masih bisa diobati dan kita bisa mengembalikan hidup pasien kembali seperti awalnya.
On the first day I said that there is nothing called paralysis, but the brain damage has to be calculated, the nerve damage has to be calculated, and then the paralysis can be recovered.
Dalam mengobati kelumpuhan, kita harus memeriksa kerusakan otak dan setelah kita memperkirakan kerusakan otak, kita bisa mengobatinya.
Paralysis is not always because of stroke. It can be because of anything inside the body and in the brain.
Kelumpuhan tidak hanya karena stroke, tapi bisa terjadi karena masalah dalam otak atau dalam bagian tubuh yang lain.
That anything has to be diagnosed.
Segalanya harus didiagnosa.
Then after diagnosis, a proper treatment protocol has to be established.
Setelah diagnosa, penanganan yang sesuai harus dilaksanakan.
And then after surgery, if there is a tumor or there is an aneurysm, aneurysm means a bulging of the artery. August, you understood what do you mean aneurysm? Aneurysm means?
Yes, aneurysm.
Yeah.
Aneurysm, yes.
Yeah. So when the artery is bulged, it is called aneurysm.
Aneurysm.
Yeah. So when there is post-operative case of aneurysm, post-operative case of tumor, various types of tumor, meningiomas means non-benign, it's a benign tumor, or non-benign is cancerous tumor, or any type of degenerative disease in the brain, myelopathy in the cervical spine, transverse myelitis, spinal cord injury, all these problems create paralysis. And by giving a proper brain stimulation, you can recover all these types of paralysis.
Berbagai penyakit seperti tumor, aneurisma, transverse myelitis, dan berbagai trauma bisa disembuhkan dengan memberikan stimulasi pada otak.
But then when you are doing brain stimulation, you must understand you are replacing another stimulation which is called ETM, electrotransmagnetic.
Dengan what stimulation?
Electrotransmagnetic stimulation, ETMS.
Electromagnetic. Stimulasi pada otak ini disebut elektrotransmagnetic stimulasi.
Yeah. So the original cost of the electrotransmagnetic stimulation is more than 4,000 jutas.
4,000
Juta.
hertz.
4,000 jutas.
4,000 juta. 4 billion?
Yeah, it is
What?
around 4 billion, correct. Original cost of electrotransmagnetic stimulation. It is a very costly project. But,
Biaya untuk
see?
elektrotransmagnetik tadi harganya adalah 4 miliar rupiah.
So, but in India, the cost of the project is around 4 crore rupees. So, in Malaysia, you see, it's 16 crores or something, 16 billion Indonesian currency, sometimes 14 billion Indonesian currency. It depends on the feature you want in your clinic.
14 billion? 14 million?
Into billion currency.
14 billion?
Indonesian currency.
Kalau dirupiahkan adalah 14 miliar.
One minute shouting. Sister, don't put your mic when you're talking to a child. One minute. Mickey is there? Yeah.
I'm here.
Yeah. So, one such a costly product, we have replaced it by just dry needle and couple of pens. It's the pen which I carry. We have restarted all. We have replaced the stimulation only with one pen. Not only one, few number of pens, which you can know as digital stimulator or called neuromodulators.
Terapi yang mahal tadi sekarang bisa kita gantikan hanya dengan jarum dan pena stimulator yang disebut neuromodulator.
Yeah. When you mean neuromodulator, it means how you give a brain impulse in the scalp. And then when you give the brain scalp, you give a right stimulation and you can see results in 5 seconds, 6 seconds, 7 seconds. And the pain can be relieved in just 2 or 3 seconds.
Dengan menggunakan alat tersebut, kita bisa memberikan stimulasi hanya beberapa detik aja ke otak dan kita bisa juga melihat hasilnya dalam waktu yang hanya hitungan detik saja.
So now you can understand such a big thing. You can replace it by dry needle and it is very cheap and best treatment.
Dan kita bisa lihat bahwa terapi semahal itu bisa kita gantikan hanya dengan jarum saja.
So one thing we must understand, when you understand brain stimulation, you must know what stimulation you give, how much you have to give, and how much you will achieve.
Dengan melakukan ini, kita harus tahu stimulasi apa yang kita berikan, seberapa besar stimulasinya, dan hasil apa yang kita harapkan.
But before understanding that, you must understand the brain anatomy, and from brain anatomy, you must understand where to give the signal, how to give the signal, how much voltage you have to give. Again, someone is shouting.
Sebelum mempelajarinya, kita harus terlebih dahulu mempelajari tentang otak, bagaimana kita memberikan signal pada otak, berapa banyak, dan selama berapa lama.
So now we'll study first about the neuroanatomy, and then I will say, see, the first thing we must understand, where to put the needle, how much you have to put the needle, and how much per second you have to give. If you give excess pulse, it will not result. If you give under pulse, it will not result.
Dan pertama kita harus mempelajari tentang neuroanatomi, bagaimana banyaknya kita harus memberi rangsangan.
Now you can see, this is how you see the brain.
Ini bagaimana kita melihat otak itu.
Most important part of the brain stimulation is that you are protected by a skull, you are protected by a cerebrospinal fluid, you are protected by number of things. And then the brain is too busy inside to go inside. Means it's too busy that it does not allow anything extra or any signal from outside to go inside.
Otak ini dilindungi oleh berbagai bagian seperti tengkorak kepala, kemudian cairan otak, dan juga otak ini sangat sibuk sekali dengan berbagai aktivitasnya dan tidak membiarkan sinyal lain masuk ke dalamnya.
So the most important part is the neuroanatomy, about which we will discuss first. Because even in neuroanatomy, if you make a mistake, remember, your whole project is failure.
Jadi pertama kita harus mempelajari tentang neuroanatomi. Kalau kita membuat kesalahan pada neuroanatomi, maka semua yang kita lakukan bisa terjadi kesalahan.
So this is what you see the brain from inside.
Ini yang kita lihat kondisi otak dari dalam.
So when you have to give stimulation, you must understand if this area, for example, this area of the brain is damaged, then which area of the brain from this area throughout the whole brain will support this area to recover.
Jadi kalau kita tahu bagian tertentu itu bermasalah, kita juga harus tahu bagian mana yang harus distimulasi untuk bisa menyembuhkan masalahnya.
So for example, there is a nerve damage in cervical area and the patient is quadriplegic. So nerve is damaged in cervical and because of the disc, the nerve is damaged. Now the patient is quadriplegic, no surgery can be done. Can you recover this type of patient? Yes, you can recover this type of patient from the brain stimulation.
Contohnya pasien quadriplegia yang memiliki masalah dari bagian cervical, kita juga bisa menterapinya lewat bagian otak.
Agus, you can speak very nicely. You told me you cannot speak. You can speak very nicely.
Actually, not that good. I think.
You are speaking very well. You are speaking very well. Congratulations. You never told me you can speak so well. After all, you are my child.
Thank you.
You must be proud that you are my child.
Yes.
So see, the first thing is the 4 lobes in the brain. What are the 4 lobes? Frontal, parietal, temporal, and occipital.
Ada
frontal,
4 lobus otak, frontal, temporal, occipital.
No. Frontal, parietal.
Frontal, parietal.
Temporal,
and
occipital.
Dan occipital.
So how many lobes are there? 4 lobes. What are they? 4 lobe. 4 means
ada 4 lobus. 4 lobus otak, frontal, parietal, temporal, dan occipital.
Yes, correct. 1 frontal, 2 parietal, 3 temporal, 4 occipital. Correct?
Occipital. Yes.
Yeah, 4 is the occipital lobe. Correct? Now you have to divide the brain into 2 things. First thing is that you see these lines. These lines are called the sulcus, and this area is called the gyrus. This is the gyrus. So this is called what?
Sulcus.
Sulcus.
Garis ini otak dibagi 2 bagian dan dipisahkan oleh garis yang bernama sulcus dan yang bagian tadi bernama gyrus.
Yes. So this is called the sulcus. Say, this is called the sulcus. Repeat.
Ini disebut sulcus.
And this area, which is enlarged area, is called the gyrus.
Dan area yang besar ini disebut gyrus.
Gyrus, correct. Now, the brain is divided into two parts. Then let's you see parietal lobe and frontal cortex is divided by central sulcus. This.
Jadi otak ini dibagi menjadi dua bagian oleh sulcus ini.
It's called the central sulcus, right?
Central
Now,
disebut central sulcus.
Central sulcus. Yes. Now, after central sulcus is postcentral gyrus and precentral gyrus, which you will see later on. Precentral gyrus and postcentral gyrus.
Listen, but I'm sorry.
Precentral gyrus. This gyrus,
Precentral gyrus
and postcentral gyrus.
And procentral. Yes. Precentral bagi dua precentral gyrus and procentral gyrus.
Gyrus. Pre means before the central sulcus and post means after the central sulcus.
Pre berarti sebelum central sulcus dan post berarti sesudah central sulcus.
Here lies the motor area. So whenever there is a typical problem, what you called our brain mapping, you can see all the scalp making. We have to make it from this area in such a way that it immediately gives command to the lower limb. And the moment you give command in such a way that immediately you should see the results.
Di bagian ini adalah area yang menguasai pergerakan, dan ketika kita melakukan stimulasi otak untuk mengobati kelumpuhan, kita lakukan di daerah ini, maka kita akan melihat hasil yang seketika.
My brother Surya always wanted to know how to do the brain mapping. So I decided to make this type of brain anatomical area, which I'll continue in 2 more slides so that you can understand some deep analysis. And once you understand the analysis of the brain, you can know where is the damage and which area you can recover the damage of this area.
Setelah kita mengetahui bagian-bagian pemetaan di otak, maka kita bisa menggunakan pemetaan otak itu untuk menyembuhkan berbagai penyakit.
So now if you see, this area is called the cerebrum. Number 1 is the cerebrum. This is called the gyrus, and this is called the sulcus. So if you see, this is the central sulcus, and all these are called the sulcus.
Bagian pertama disebut cerebrum, bagian kedua gyrus, dan ada 3 sulcus. Dan ini semua bagian ini yang tadi ditunjuk itu dinamakan sulcus.
And this is called the lateral fissure. This area is called the lateral fissure.
Dan bagian ini disebut lateral fissure.
This lateral fissure connects the frontal cortex and the temporal lobe.
Lateral fissure ini menghubungkan frontal cortex dan lateral lobe.
Yeah. This cut, you can see this cut also contains the parietal lobe and the temporal lobe.
Potongan ini mengandung parietal lobe and what? Sorry.
Temporal lobe.
And
this is the
temporal dan lobus temporal.
Yeah. And now you can see the last part of this cut.
Bagian potongan terakhir ini.
This cut, you can see this last part of the cut. This cut associates with the occipital lobe in this area and also the last part of the temporal lobe.
Potongan terakhir ini berhubungan dengan occipital area dan bagian terakhir dari temporal lobus.
So now you can see what I told you. This is the frontal lobe. This is the occipital lobe. This is the temporal lobe. And this is the parietal lobe.
Ini adalah lobus frontal, yang kedua itu lobus temporal, 3 lobus occipital, dan yang keempat lobus parietal.
Yes. So all these are the lobe of the cerebrum area.
Dan ini ada lobus-lobus dari area otak.
Cerebrum. Did you tell about the cerebrum? These are all the lobe of the cerebrum.
Ini adalah lobus dari cerebrum.
Very good. Very nice. Now you can see the internal part of the brain. When you dissect the brain, when you cut it down, what do you see? You will see the first the white matter. It's called the corpus callosum.
Kalau kita membuka bagian otak, dalamnya kita bisa melihat ini bagian ini adalah corpus callosum.
Yeah, this corpus callosum is the part which gives information from the right to the left and left to the right.
Corpus callosum ini adalah yang menyalurkan sinyal dari kanan ke kiri dan kiri ke kanan.
One minute, I'll explain you. See, the brain is two parts, right and left, correct?
Otak ada dua bagian, kiri dan kanan.
Yeah. So in between the right information to the left information of the brain, who gives this connects the brain from the right lobe to the left area of the brain, right brain to the left brain, which connects it? It is the corpus callosum.
Otak ini ada dua bagian, yang kanan dan kiri, dan dari informasi dari bagian kiri ke kanan ini adalah corpus callosum ini yang menyalurkan.
So now you can see this is the lateral ventricle. This area is called the lateral ventricle. Yesterday I told you about this lateral ventricle. If there is a lateral fissure infarct, so this is the area where you can have the bleed or some type of hemorrhage over here, and then the patient become paralyzed for his whole life. It's called the lateral ventricle. This area is called the lateral ventricle.
Bagian ini adalah lateral ventricle, seperti yang sudah pernah saya ajarkan sebelumnya. Ada seorang pasien yang mengalami pendarahan di otak bagian lateral ventricle ini dan dia mengalami kelumpuhan.
So this lateral ventricle has around 65 ml of CSF, cerebrospinal fluid.
Lateral ventricle ini memiliki cerebral fluid sebanyak 6.5 what?
65 ml. 6.5
mililiter.
Yeah, more than 65 ml of the CSF fluid is stored in this part of the ventricle. So whenever there is a stroke or any external damage from the brain, this is a trauma injury, we call it a subdural hemorrhage or extrasubdural hemorrhage because of the fracture in the skull. The cerebrospinal fluid comes inside the brain, and because of this, there is a lot of swelling inside the brain. First, there is a swelling because of injury, and second, because ventricle fluid, CSF fluid enters the brain, and because of that lateral part, there is more swelling, and because of this, there is a midline shift, and there is a danger of losing the life of the patient.
Ketika terjadi trauma atau stroke dan berbagai masalah, maka dari bagian ini bisa keluar cairan otak dan bisa terjadi pembengkakan di otak dan bisa menyebabkan garisnya bergeser, dan kondisi ini juga bisa membahayakan jiwa pasien.
So this area is called the temporal lobe.
Bagian ini dinamakan lobus temporal.
And now you can see this is the frontal lobe and this is the anterior view of the brain.
Dan bagian ini adalah lobus frontal dan ini adalah bagian anterior dari otak.
Guru, we did not see your slide.
Oh, you did not see? Oh, so sorry. No one told me all this. You should know I'm a nonsense.
I can see your slide.
We are seeing, sir.
See the slide also.
We can see your slides, sir. You should check his scroll on his screen.
Now you can see?
We can see, sir.
Yeah, we can see, sir.
We can see.
So do I.
August, can you see the slide?
Yes, I can see.
With your voice over, we are able to see the slides, sir.
Huh?
With your voice, we are able to see the slide correlate.
Acha, you can correlate both?
When we are seeing the slide, we are able to hear you. So it is easy. If we are seeing you in video, the slide will not be visible. So if you see the slide, your voice is audible to us.
So now what you are doing?
I am seeing now your
Okay. Now I can see the slide. Thank you.
Okay.
slide. I am able to
This
see,
is-
sir.
You can hear my voice also and slide
Yes,
also?
I can also. Yes, slide also, voice also.
We can see your slides, we can see your camera, we can hear your voice. Everything is
You are seen in the small right side on the top of the corner, and the slide
Okay.
is
1 minute. Wait, okay. I'll just
Yes.
repeat it. 1 minute. Of course, you don't need to repeat it. I'll just repeat it for Ronnie, what I have spoken.
Okay.
See, this is the, you don't need to repeat me, okay? You have already
Okay.
spoken. Yeah. So this is the brain.
Yes.
1 minute. Someone is speaking. Yeah. So here you can see the total area of the brain. Now, when you speak about brain stimulation, it is classified into 3 parts. One brain stimulation is called deep brain stimulation. Ronnie, can you hear me? You can open your mic so that we can speak to each other.
Yes.
Yeah. Ronnie, there are 3 classification of brain stimulation. One is deep brain stimulation, which we cut the brain and you put apparatus inside. This is very risky. Sometimes the patient may lose his life, and it is not necessary that Parkinson patient will improve. There is a case with Chandrakant also, where you gave a brain, brain apparatus was inserted, and the patient became paralyzed because of the extra voltage generated inside the brain. So this type of brain stimulation is very risky and also very costly. Second comes the non-invasive brain stimulation, which is classified into electrotransmagnetic stimulation. That requires a very big setup, lot of understanding, lot of things are required, lot of licensing procedure, and it costs you around how many Singaporean dollars? 100,000, 200,000, 300,000, 400,000, 500,000, 600, 700, or 800,000 Singaporean dollar. The non-invasive brain stimulation costs you from 5,000 Singaporean dollar to 600,000 Singaporean dollar, 600,000, right? So that stimulation is non-affordable for the human body. We cannot afford it in a small setup like your clinic and my clinic. So what did I do? I studied the neuroanatomy, I studied everything, and I brought the cost to a very low extent. Now, if you know about the impulse of the brain, you can generate it with your nose, you can generate it with the hair, you can generate the same impulse by the pain, you can generate the same impulse by your nails, you can do it by anything. You don't need a very big machine. If you understand how much voltage is required, you can generate it with the nails also, you can generate it with the pain also, you can generate with your own hairs also, and you can even generate the impulse from the nose, the dirt of the nose also. Correct? Ronnie? Did you understand?
Yes.
Yeah. Now when I'm speaking, this is about the brain. So you can see the enlarged area is called the gyrus and this is called the sulcus. So sulcus is the area. The brain is divided into 4 parts. What are they? Frontal, parietal, temporal and occipital, right? So occipital comes here, temporal comes here. This is the frontal, this is the parietal, and this parietal and frontal is divided by central sulcus. The line which you see is called the sulcus, and the area which is enlarged is called the gyrus. So this is called the precentral gyrus, and this is called the postcentral gyrus because this is a central sulcus. So the central sulcus divides the brain into 2 parts: temporal lobe, no, parietal lobe, and the frontal lobe. So this parietal lobe and temporal lobe, parietal lobe and the frontal cortex is divided by central sulcus. So this central sulcus integrates air with the lateral fissure, and this lateral fissure becomes a part of the temporal lobe. And this later on, this cut also associates with the of the occipital lobe. Correct? So here you can see the central sulcus, which is very important. You asked me one question: what do I calculate inside the brain? I calculate what is the damage, which area of the brain is damaged, and which area of the brain can recover, and how to reach that area, the damaged area and this area, how to communicate between them. It is just like the communication between me and Surya, because Surya is damaged. I want to establish the communication, but then until the communication between two is established, we cannot have a seminar in Indonesia. So to create that, give up that gap, what we do, we established a Zoom class. This Zoom class is called non-invasive brain stimulation. Am I correct?
Yeah, fantastic.
I hope you understood what I spoke.
Yeah. Thank you, got it.
So now you can see the four lobes. You can see this is the frontal lobe after the central sulcus, and this is the gyrus. So from the central sulcus, the brain is divided into two parts. It is called frontal lobe and the parietal lobe. This occipital lobe is the area where you stimulate and you recover the eye. You asked me how to recover the eye when it is damaged. It is the occipital lobe, and this is called the temporal lobe. Correct?
Yes.
This is the cross section of the brain. This is called the corpus callosum. This corpus callosum is the area which transfers messages from right lobe to the left lobe and left lobe to the right lobe. For example, I am slapping you with my right hand and you protected it with your left hand. Who gave you this signal? Or I caught you with two hands and then I slapped you with the right hand. This transferring of images is called what? From which area it is transferred? It is transferred from the corpus callosum. Yeah. So now you can see the lateral ventricle here. Here is the ventricle which stores the cerebrospinal fluid. In lateral ventricle, there is a choroid plexus. So we call it the lateral choroid plexus. This lateral choroid plexus, they manufacture CSF, cerebrospinal fluid, into 0.3 to 0.25 ml by 0.45 ml. We said from 0.25 ml to 0.45 ml per minute they are producing cerebrospinal fluid, the choroidal plexus, right? In lateral ventricle, this is called the lateral ventricle. Here there is a anatomy called choroid plexus, right? This choroid plexus, they manufacture, they are the producer of cerebrospinal fluid. So generally, in a brain for the whole day, this lateral choroidal plexus and all, they generate how many ml of CSF? They generate around 600 ml of CSF. So whenever you sleep in the night, your brain becomes more active. It is like I call it the brain becomes Thailand. And the nightlife of Thailand is more active. Na? People go for sex and everything in night. So brain also do its own sexual interaction at night. It takes all the cleaning of the brain is done when it is done in the night. And this process is called glymphatic system. In glymphatic system, the neurotransmitters enters inside the brain from the CSF produced in the lateral ventricle, and from there they clean in the pathway of the brain, and then they do two things. One is cleaning and one is cooling. So the cleaning and cooling part of the CSF is done by where? From the lateral ventricle. This lateral ventricle produces CSF. So it is produced by the two ventricles, and there is called the fourth ventricle. So these four ventricles, two lateral ventricles, the fourth ventricle and all, they produce what? The CSF fluid from the choroid plexus. Yeah, from the choroid plexus. This choroid plexus, they produces a CSF, and this CSF cleans the mind, right? Otherwise, if this CSF is not cleaned, you will suffer from what? You will suffer from lot of anatomical problems, neurophysiological problems. They are called Alzheimer's. They are called what? Paralysis. They are called from 200. Any type of disease you can suffer, right? And that is why I said the person who came from Singapore who did not took the treatment properly, and he said, I'm okay, it's okay after taking the medicines, but if you withdraw the medicine, what is his status? That has to be seen. On medication, everyone is stable, but after you remove the medication, what is the status? That is your real status. So when you say that my real status is okay after taking the medicine, Fong, do you remember that patient of Parkinson? Fong? Fong from Singapore. Fong, Clarence Fong. I think Fong is not there.
No, I'm
Fong.
here. Yeah.
Fong, do you remember that patient of Singapore
Yeah, that's right.
who suffered from Parkinson?
Yeah, that's right.
What did he say? He said that I'm stable, I'm okay. But after taking medicine, he's okay. Without medicine, is he okay?
Yes, that's right. But
Pseudo result.
that's what happened in many places when the patient takes medicine. It's okay, Yeah.
They feel that they are okay.
Mm.
They feel that they are cured. But if you withdraw the medicines, what happens?
It won't last. Yeah, it won't last.
It won't last. And that is why I say, Chen, you open your camera. A mic. Chen, you have to open it. August, open your mic. You have to open it. I opened it. August, can you hear me?
Okay. Yes, I can.
Yeah. And now this is called the nerve tract. This area, the greenish area is called what? Nerve tract.
Bagian ini disebut trakt saraf.
Now you read out this paragraph in what do you call? In Malayalam, this Bhasa, Indonesian Bhasa. For your information, during the development of the corpus.
Untuk informasi, dalam masa pengembangan korpus kolosum mulai di bagian anterior otak dan tumbuh secara posterior. Beberapa jaringan otak anterior diseret ke arah posterior dengan korpus kolosum yang berkembang. Di model ini, jaringan ini diwakili oleh garis hijau di bagian korpus kolosum. Di otak orang dewasa, jaringan ini menghubungkan bagian otak anterior dengan bagian otak yang lain.
Now I'm asking one. Okay. Over.
Bagian jaringan ini bisa dilihat waktu kita mempelajari di otak selanjutnya, membedah otak selanjutnya.
Very good. Now, my first question is, do you know which area of the brain is damaged and how to recover that damage? If people do not know where is the damage, number one, how much it is the damage, number two, because of this damage, how much paralysis has occurred in the body. And since we do not know anything about the brain damage, we do not know the impact of brain damage in the body, and we try to recover it with Zhao Sunfa scalp, we try to recover paralysis by Zhu scalp, we try to recover paralysis by Yamamoto, and all these three techniques may be partially correct, but they are not fully correct because they never tell us which area of the brain is damaged and how to recover that damage.
Kalau kita tidak mengetahui bagian otak mana yang rusak, seberapa banyak kerusakannya, bagian mana saja dari tubuh kita yang terpengaruhi oleh kerusakan otak itu, jika kita hanya menggunakan teknik scalp lainnya seperti Suscap, Yamamoto, dan lain-lainnya, mungkin kita bisa mendapatkan hasil, tapi hasil itu hanya sebagian saja, karena kita tidak tahu bagian mana di otak yang mengalami kerusakan.
Now you can see this is called the insula. Now we cut the brain more, and now we entered inside the brain. So this is called what? The insula.
Bagian ini dinamakan insula yang terdapat di bagian dalam kalau kita membedah lebih dalam lagi.
This is the lobe of the cerebellum. Insula is a part of the cerebellum.
Insula adalah bagian dari cerebellum.
Yeah, now we have removed the right hemisphere of the cerebrum. What we have removed? We have removed the right hemisphere of the cerebrum, and now you can see that after removing the right hemisphere, this is the internal area of the brain.
Ini bagian dalam otak ketika kita memindahkan hemisfer kanan dari cerebrum.
Yes. So now you can see this is the internal capsule.
Ini adalah kapsul internal.
So this you can see as the white matter.
Yang dilihat sebagai bagian berwarna putih.
So now you can see this is the cross section, and you can see the lateral ventricle, which produces the CSF fluid.
Ini adalah lateral ventricle yang bagian yang memproduksi cerebral spine, cairan cerebral spine.
Cerebrospinal fluid.
Yes, cerebrospinal fluid. Fluid is cairan. Yes, in Indonesian.
What do you call in Indonesian cerebrospinal fluid? What do you call?
Cairan otak dan tulang belakang.
Tulang belakang.
Yes.
Very big pronunciation. Tulang belakang. We call it CSF. Tulang belakang. Very difficult.
Belakang.
Belakang. You write and give me. I will memorize later on. So this is the corpus callosum. Now this combines the brain with this area.
Ini adalah corpus callosum yang menghubungkan bagian otak yang kanan dengan kiri.
Now you can see the central sulcus very beautifully.
Kita bisa lihat central sulcus sangat indah.
Now you can see the primary motor cortex. This is called the primary motor cortex area of the brain.
Ini adalah korteks motor primer dari otak.
Now people say, sir, there is a voice aphasia and you cannot speak from so many years. Now you see how much mistake this person has done. That is what I call jaw sanfa. If I get my sleeper, I'll beat him on his head. He does not know how to focus being a neurosurgeon, how to focus on the Venkis area and how to focus on the Broca's area. And he says, just put the needle over there and it will recover the Broca's area. Miss voice aphasia. Speak.
Salah satu.
1 minute. I'll repeat. You say slowly. Okay. This is the central sulcus.
Ini adalah central sulcus.
So now when we say precentral gyrus, it becomes a frontal cortex, primary motor cortex. So this area is called what? The primary motor cortex.
Ini bagiannya adalah korteks motor primer.
Now you can from primary motor cortex, if you go little bit left, you will see the premotor area.
Ke kiri sedikit kita bisa melihat area premotor.
Yeah. So now you can see this is the premotor area. Which area? These two area is called the premotor area.
Bagian ini dinamakan area premotor.
And this area is called the Broca's area.
Dan area ini adalah area Broca's.
Yeah. Now if you see, if you have some problem in the voice aphasia, you have to use two areas. This area also and this area also. And you have to put 2 needles below the sublingual. I think you can see. Yeah. You do not see the acupuncture point, but you must know where is the difficulty in pronunciation. So that pronunciation you have to bring to your tongue, and then you have to attach it with Venkis area, and then with the Broca's area, and then if you stimulate properly with the right stimulation of the pain, you will get immediate recovery in the case of voice aphasia.
Pada kasus kesulitan berbicara pada pasien adalah area ini yang harus disimulasi, yaitu area Broca's dan Venix.
Kuliah Mbak Oman. Gurunya orang India.
What did you say? Hello?
She said that
Hello?
the teacher is Indian.
Oh, the teacher is Indian. Yeah, I'm an Indian teacher. My pronunciation is also Indian. What I will do? Yeah, continue. Agush, continue.
Okay. Yes, already finished.
So now,
Otak.
only Indian teachers have the capacity to take out the sleepers and beat this nonsense people like Joe Sanfa. So now you see, until unless you know the brain anatomy very nicely, you do not know why is there a voice aphasia. Always stimulating the Broca's area will not recover the patient. Always stimulating the frontal area will not recover the patient. And no other voice, please.
Yeah, I cannot hear
Itu kapan
clearly.
malam ini kayak gini. Sekarang
1 minute.
ini pakai Zoom. Ini guru itu
Now you can hear?
Yes.
Yes. So August, you were asking me in the seminar why so many types of scalps are required, why I practice this, that, and why am I moving my hands. So when I'm moving my hands, I try to visualize from which area I can take a pathway and which area of the brain will help me to overcome this problem. And that is called brain mapping or bridge between the two areas of the brain.
Waktu seminar saya pernah bertanya ke Master Sastry ini, kenapa beliau menggunakan tangannya itu? Dia menggunakan tangannya untuk menggambarkan daerah-daerah pemetaan otak untuk memvisualisasikan area-area otak.
So, do you remember, Agus? There was a person who told me that he's having some disease like cancerous disease and he's having some problem with his father and there was a wasting of muscles in his hand. Do you remember that boy, that person, Agus?
Yes.
Yes. And then I say, you have to change, you have to check the temperature of the genital area. And then you said that person told me that I am a gay. Do you remember that person?
Yes.
Yes, you should remember that person. But it was not that because of knowing from the temperature of the genital area in the night, you understand whether the CSF is doing rightly on the reptilian brain or not. If there is some problem in the reptilian brain and the CSF, the temperature of the genital area in the night is high. And if it is high, the patient is shortly going to suffer from neurological deficit. It is the wasting of muscles and gradually it will result to paralysis of the whole body. Speak.
Bagian kelamin di malam hari jika temperaturnya tinggi maka menandakan ada masalah di otaknya dan jika itu terjadi maka dia bisa mengalami kelumpuhan dalam waktu yang dekat.
You told them that person called me gay? Tell.
Orang
Yes.
itu mengatakan bahwa Master Sastry itu gay.
Yes. I wanted to teach these people that how to understand the neurophysiology, neuroendocrinology, and neuroanatomy with the brain. And these people say that we professors are gay. Repeat.
Saya ingin mengajarkan tentang neuroanatomy ini, tapi malah orang-orang mengatakan saya ini gay.
Yes. So you see, you don't understand the brain, you don't understand the body temperature, you don't understand anything. How will you do diagnosis and how will you treat the patient from the brain?
Kalau kita tidak mengerti tentang neuroanatomy, kita tidak bisa mendiagnosa dan mengobati pasien.
So now, again, you come to the central sulcus. This is the central sulcus, right?
Bagian
now,
ini adalah
go. Central sulcus, right?
central sulcus.
Now, whatever taste of the tongue you have, so many people in the what you called in seminar, they come with a patient of stroke and they say that there is no taste in the tongue. They cannot feel any taste. So it is not the problem of the taste bud, but this area of the brain, which is just called near to the postcentral gyrus. It's the frontal cortex. So central, this is the,
I'm sorry, can you repeat?
Yes. Many patients who come in the seminar and in our clinic, they say we cannot feel the taste of the food after the stroke. You know why? Because of this damage in this area.
Banyak pasien yang datang ketika seminar dan di klinik yang mengalami stroke dan mereka tidak bisa merasakan rasa makanan, mereka mengalami kerusakan otak di bagian ini.
You must be capable of to be know the see. Whenever you ask me, sir, why you don't teach us advanced stimulation? I cannot teach you advanced stimulation because you are not ready to learn it.
Saya tidak bisa mengajarkan semuanya karena harus dipelajari satu persatu.
The first thing when you have to study about the brain, there are two things which gives you the correct picture about the brain. One is the genital area of the body, and one is the eye pupil of the body, brain. Eye pupil, pupil of the eye. Chen, can you hear me? Chen?
Ya, Pak Agus.
Agus ran away. Agus. We have to wait for 1 minute for Agus. Agus. Ronaldo is there? Ronaldo, can you help me for translation? Ronaldo?
There are 73
Doctor,
members totally. There is no person can translate.
except Mickey, anyone is there who can translate? I don't want to say always Mickey. Anyone else? Agus, you are there? Oh, Vajuni Haroto. Dr. Haroto, can you help me to translate? Dr. Jiv Haroto, can you help me to translate?
Bagaimana kalau kita mau ngomong nih? Halo, bagaimana kalau mau ngomong? Dia kan manggil nama aku kan. Halo, bagaimana caranya?
Can you help me to translate?
Ini udah masuk suaranya.
Halo?
Can you hear me? Can you hear me, Dr. Haruto?
Yeah. I'm here. You.
Can you help me to translate?
Pardon?
Can you help me to translate from English to Indonesia?
Mika helped me very much.
Oh, Mika help you. Cannot help me. Okay, it's okay. Agus, you are there? Agus? I think Agus has gone. I think Agus has left, nah? Agus is there or gone? Chen?
Gone, sir, gone.
Anyway, Mickey, you can come. Bad luck.
Why don't you ask for Dr. Haryoto? You can, but if you want me to help, it's okay. With pleasure.
Vanuto will help you, and let us go with Mickey again till Dr. Chen
Okay.
comes.
Okay.
Ask August is coming or not, or he left. Ask August. Oh, his Zoom has been closed automatically. The phone has become too hot. Tell August to buy a new phone. Anyway, you wanted to learn this, but then bad luck, you could not learn it. So this is the area. I'm going to mute all of you. Then you can open your cam.
Oh, dengar suaranya.
From soon, because it is important.
Ini benar besok bisa dikasih.
Buat besok kan bisa kita.
So now you can see this is the area which induces a test in the person after the stroke. So after surgery or after so many problems in the brain, you lose the test because of the lack of this area. Now Johnson first said, if you stimulate this area, then only you will get the test, but it is not like this. This area is damaged, and only the other area can recover this area.
Bisa.
Mickey, translate. Mickey.
Yes.
Mikey.
Ya.
Translate.
Halo.
Translate.
Jadi ketika terjadi keadaan pasien tidak bisa mengecap, tidak merasakan rasa makan apapun, maka yang rusak adalah wilayah central gyrus. Kalau menurut Joshua Anfa itu tidak demikian ceritanya.
Joshua first said directly stimulate the motor area and you will recover the motor area. It is not possible. If the area is damaged inside the brain, to create neuroplasticity, you cannot directly insert the needle in the surface area of the frontal cortex or the primary somatic primary motor cortex, and you can get the stimulation and the area will recover. It is not like that.
Kalau menurut Chua Sunfa, bila terjadi hal seperti tadi, kita cukup memberi treatment pada wilayah motorik, tapi tidak sesederhana itu sebetulnya.
Yeah, just inserting needle in this area, tuk 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 tuk, will not recover the patient.
Jadi tidak cukup dengan menusuk pasien beberapa jarum di wilayah ini, lalu pasien bisa sembuh. Tidak bisa.
Because until the damage inside the brain is recovered, until the muscles are recovered inside the brain by the commands of the brain, body will never recover.
Jadi sebelum wilayah otak yang rusak itu diperbaiki, maka tidak akan ada pemulihan pada pasien.
So now if you want to recover the sensation, this area is damaged. You can see in the color in the blue. It is called the somatic sensory association area. And then you can see it's called the sensory area of the brain, which is after the postcentral gyrus. So if you think that this area will recover by just stimulating this area as given by them, I never think it will be possible, because to recover this area, you must understand one beautiful concept, that you must create neuroplasticity. There should be angiogenesis, there should be neurogenesis, there should be anatomical change, functional change, by an appropriate neuroendocrine change. See, there are three changes which you have to bring: neuroanatomical change, neurofunctional change, neurophysiological change, and then also the neuroendocrine change. So these four changes you have to bring after the brain damage, and then you can recover you can create what? Neurogenesis or angiogenesis. When you create this angiogenesis, what will happen? new blood vessels will grow. The moment the new blood vessels will grow, there will be the growth of the neurons. Once you grow the new neurons, then training the new neurons. So everything when you include is called what? Neuroplasticity. And then you must give the right signal inside the brain. Buying a Chinese pen and giving any type of signal will recover the brain is the biggest foolishness of all the doctors. Speak.
Jadi, misalnya terjadi kerusakan pada wilayah somatic sensory. Kalau jarum yang berwarna biru, berwarna biru, dengan meletakkan jarum di sana, tidak akan ada perbaikan. Kenapa? Karena kita tidak bekerja pada wilayah otak yang rusak. Kita tidak memanfaatkan kemampuan otak untuk berubah secara anatomi, fisiologi, fungsional. Itu yang sebetulnya harus kita lakukan. Tanpa melakukan itu semua, tidak akan terjadi neurogenesis, tidak akan terjadi new blood vessel, ya, tidak akan tumbuh pembuluh darah yang baru, tidak akan ada neuron-neuron yang baru. Secara sederhana, tidak akan terjadi neuroplastisitas.
So until there is neuroplasticity in the brain, whatever you recover is failure.
Jadi kesembuhan hanya akan diperoleh jika kita berhasil membuat neuroplastisitas pada otak. Hanya jika itu terjadi, kesembuhan kita peroleh.
Now you can say primary auditory cortex. This is the auditory area. Means from here you have seen I have recovered many deaf people in my life. So I create a pathway from this area to the area of the occipital area. This is called the visual cortex. I create a pathway from here to here. I create a pathway from here to this area. I create a pathway from here to this area. I create a pathway from this area to this area. I create a pathway from this area to this lower area. So I create another pathway for every patient. And once the brain damage is recovered, you can hear, in many deaf patients, you can hear immediately.
Pada kasus gangguan pendengaran, misalnya tuli, maka yang harus kita lakukan adalah membuat jalur, membuat pathway dari wilayah auditory cortex primer, bisa ke arah visual cortex, bisa ke arah area asosiasi visual lainnya. Jadi dengan membuat menciptakan berbagai macam jalur pada pasien yang berbeda-beda, jadi individual, maka bisa diharapkan gangguan pendengaran akan pulih.
Now you see, since you do not know all this, you blame us that we do something wrong to you people. But then you understand, we all are doctors. What we will do? Why are we all like this? You must understand the clinical manifestation, that if this is happening inside the brain, where to test, what to test, and how much. Now if you see, without putting the finger in the anus, how will you recover the coccyx? How can you do the setting of the coccyx? You must have to go inside the anus, then you have to insert it tight, and then you have to give overstimulation, and then externally an internal pressure stabilizes the coccyx bone. So this all you must learn while you practice, because whenever you practice the critical case, you must know what to do so that the patient gets immediate recovery.
Jadi kita harus tahu persis apa yang akan kita kerjakan. Semua ini membutuhkan pengetahuan. Ada banyak orang yang tanpa pengetahuan, mereka kemudian menyalahkan dokter. Padahal mereka sebetulnya tidak tahu apa-apa. Ya. Jadi kita harus tahu manifestasi klinisnya bagaimana.
So those who came in the beginning, many of them has gone by now. See. So when you insert the needle in one area, oh, you are back, Agus? So when you are Zoom, when you are back, let me know. August, I want to complete the class with you because you were the one who told me I did not teach you. So now I'll make you translate if you are back. August, if you are back, Dr. Chen, are you there? I think he has gone, Dr. Chen. Dr. Chen, are you there? See, I can understand who is in the class, who is not there in the class. Yeah.
Here.
Who?
Can you hear me?
August, you have come?
Yes, yes.
Yeah,
Can you
I
hear
can
me?
hear you. Me, you can go. August has come. Yeah. Today I'll take my class with my son. So everyone was asking, who is my son? You can see my son, Chinese son, who has no mother. Since I don't have a wife, August has no mother. See, similarly, this is not a joke. This area of the brain is damaged. So if you do not correlate it with the other area, that is why I said yin in yang and yang in yin. That means what? If this area has a corresponding areas in the brain, who can support this area? For example, when I am taking the class, Agus is supporting, Gambira is supporting, and many Sinesh is supporting. So when everyone will give me a support, I can recover the brain. So similarly, if this area, auditory area, means if you are deaf, you can recover this deafness by doing a good brain mapping. So every brain mapping is different. Every person who is having a different damage inside the brain because of different reason, he can be recovered by a good brain mapping. Yes. Next. Speak.
Jadi kalau sebagai contohnya kalau primary auditory cortex ini rusak, bagian ini terhubung dengan bagian bagian ini terhubung dengan bagian lainnya dan saling mensupport satu sama lain seperti layaknya hubungan antara yin dan yang. Jadi untuk memperbaiki area ini kita harus mengembalikan hubungannya dan membutuhkan dukungan dari bagian-bagian lainnya, dan kita melakukan brain mapping sehingga kita bisa memulihkan bagian yang rusak tersebut.
So Agus, you can do one thing. Now you can tell that person who told me I am a gay, you can convey him that I am not a gay. I was just telling him how to do the brain temperature inside the body, right?
Can I ask a question?
Yes.
Oh, Dr. Chen is there. I thought you ran away.
Can I ask a question?
Yeah. I will answer your question. Just give me 5 minutes. Let me complete this anatomy class. Then we'll answer all the questions. Agus, see, you told me one thing. That person told me that if there is certain degeneration inside the body, there is also degeneration in the CSF fluid inside the brain. If there is a degeneration in the CSF plane, the brain will get heated up, and this heat will be imbalanced heat in different areas of the body. So the first difference of the heat you will feel in the genital area. Then you will feel the heat in the different muscular area. And then you can ascertain that yes, there is some damage inside the brain and the CSF flow. So you can understand, until or unless you clear the CSF from the brain, you cannot recover the damages of the brain. Agus.
Bagian otak berkaitan dengan bagian tubuh tertentu, dan temperatur bagian tertentu yang meninggi bisa dikaitkan dengan masalah yang terjadi di otak. Jadi kalau kita tidak mengecek bagian tersebut, maka kita tidak bisa mengetahui kerusakannya yang terjadi di otak.
Very
Dan
good.
dengan demikian kita tidak bisa memperbaiki kerusakannya.
Now you can see, Fahmi is there? Fahmi Rashid? Fahmi, can you come? Fahmi?
Yes, I'm here.
Fahmi bhai, I told you on the phone call that one day, you remember when we had a night discussion, I told you, this is the area we have to go, this internal area. So how by the surface stimulation, how by crossing the skull, how by crossing the cerebrospinal fluid, How by causing all the signals inside the brain, how will you enter this area to recover the gluteus area? So this I told you that day. Do you remember?
Yes, yes.
When you were having a night discussion.
Yes, I
So,
remember.
So now you imagine, for example, to stimulate the gluteus, we have to come to this area, and that impulse has to be given in this area. So if you give a proper impulse, the neurons connected from this area will stimulate this area, and the gluteus will recover from here. But if you try to come inside this area, it is not possible. That is why I say the right voltage will only create a neurophysiological change, which will recover the neuromuscular power of the body. Yes. For me, you may go. Cheng, you may come. Chen, Agush?
Yes.
Yeah, speak.
Very make it simple. Very long. You can. Sorry, too long.
That is why I like to torture you. Can you hear me? Chen, can you hear me?
Yes, I can. Yes.
See, this is the surface area of the brain. Speak. This is the surface.
Ini bagian permukaan dari otak.
Right? We can only put needles in this area, correct?
Kita hanya bisa menaruh jarum di area ini.
But then we have to recover this area. How to do this? Because we cannot cut the brain and come in here and repair it.
Tapi kemudian kita harus memperbaiki kerusakan di area yang lain.
So now, if you want to recover this area, you cannot stimulate this area to recover because this area is already dead. It is called infarct, or it is called what? Hemorrhagic stroke. Because of the hemorrhagic stroke, there is gliosis. Because of the gliosis, this area is dead. Now, can you recover this area or this area or this area by just giving a stimulation in this area? Is not possible. Speak.
Jika bagian kita ingin mengobati bagian ini, tapi bagian ini sudah terjadi kerusakan, bisa terjadi karena pendarahan, stroke pendarahan, dan kemudian terjadi glikosis, maka area ini rusak dan jika kita menstimulasinya tidak akan terjadi reaksi.
So now you can see this is the prefrontal cortex and this is the premotor area. Now we have to, when you have to work with the motor cortex, you also have to work with the prefrontal area. So that is why I said I created a holography for you so that it becomes very easy for you to practice rather than practicing from the anatomy of the brain.
Ini adalah bagian prefrontal dan ini ada premotor, dan kalau kita ingin memperbaiki bagian motor kita bisa ambil dari bagian prefrontal, dan saya sudah menyiapkan gambar animasi yang bisa kita gunakan untuk belajar.
That is why I said in Indonesia 600 years back, Surya Sastry scalp was practiced and his ancestor taught me this technique and we could recover large number of patients. And that is why I say Surya Sastry scalp is given from Indonesia and you could have supported the whole world. But because Surya is not with me anymore, I don't practice this technique. But this technique was the most wonderful technique of the world.
Teknik scalp Surya Sastry adalah salah satu teknik scalp yang sangat bagus di dunia, tapi saya sudah tidak menggunakannya lagi karena Dr. Surya sudah tidak bersama saya lagi.
Over? You can hear me?
Yes, over.
Yeah, over, okay.
Yes,
so
yes,
see,
I can.
Yeah, so now you understood.
Yes, sometimes it's blurred. Sometimes the voice is blurred.
It's okay. It is internet connection.
Signal,
what I can do.
Sometimes
yeah,
it's blurred.
Signal. Because you don't love me, so it is the signal like this. If you love me so much, the signal will not become bad. Yes. Now you see how important it becomes to keep the right voltage inside the brain. Now you do not know how much voltage we have to give to the trigger the neurons. Triggering the neurons means giving a surface stimulation, which stimulation has to go inside the busy roadway of the brain. And then that signal has to enter the brain like a virus. And then he has to go to that particular area like this. And then he has to stimulate from ear to ear. And then from this stimulation, you can see the immediate action in the body. And that is called the nerve and muscle contraction.
Jadi kita tidak tahu berapa besar voltase dari stimulasi yang harus kita berikan pada area ini dan bagaimana reaksinya nanti yang terjadi pada tubuh kita. Reaksi ini disebut reaksi otot dan saraf. Okay.
Yeah. Please give this lecture to my brother because he wanted to know about neuroanatomy and all. Please give it to my brother, right? Agush, give it to my brother,
Yes.
okay? Give it this lecture, recorded lecture will give you. You give it to my brother.
Dr. Surya?
Yes, who else is my brother? Yeah.
Oh, yes. Okay. You have so many brothers.
Actually, they are brother, but he's brothers. There are so many brothers. We always denote everyone by brother. Like whenever you call, I call Dr. Fami. We don't call each other as Dr. Fami, or he does not call me as Dr. Sastry. We just call it as brother Fami, brother Sastry, brother Faisal. It is a culture in India. We all called colleagues. We call it as brother to each other. Like all the judges in Supreme Court, High Court, they call it as brother judge. So similarly in India, either we call him like a doctor or we call him as a brother or sister. Sister, please, can you help me? Brother, can you help me? This is how we say each other. Understood?
Yes, yes.
But when you speak about my brother, when I say my brother, that means Surya. But when I say brother Faisal, brother Fami, brother this, that means it's a colleague and personal, professional relationship. When I say my brother, means it's a personal relationship. Correct? Difference between two cultures, Indonesia and Indian culture.
Yes, yes, correct.
And now we'll come to the sensory, somatic sensory association area. So see, whenever there is a sensory deficit, this area of the brain stops functioning. It is the nerve which has stopped giving stimulation to this area. And this sensory nerve in the spine, are associated to this area of the brain to get the sensation like hot, cold, and other sensation. Do you remember the patient you brought me said she has a lot of numbness and she cannot feel sensation in the lower limb? Do you remember the lady which we treated in the temple?
Yes, yes.
Who bought me a lot of sweet, but that was having a lot of egg, so I gave it to you. Do you remember?
Yes, 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 I remember.
So this area of the brain was damaged in that lady. This area.
Jadi area somatic sensory association ini mengatur rasa di bagian tubuh. Jika terjadi masalah, maka bagian tubuh tertentu bisa terjadi masalah di sensorinya.
Yeah. Now one thing I want to tell you, I had -25. My eyes was 75% blind. By using brain stimulation from this area, I recovered this area, the visual cortex. So for example, if I want to recover the eye and I put my needle in this area, it will never recover because this area is already damaged. So to recover this area, you must use the friendly areas of the brain. That taking help from the friendly areas to recover this area is called what? Brain mapping.
Saya memiliki masalah pada penglihatan saya kehilangan hampir 75% dari penglihatan. Jika saya berusaha menstimulasi dari bagian visual association area ini untuk menyembuhkannya, maka tidak akan berhasil. Jadi saya harus menstimulasi dari bagian lain yang terhubungan dengan area tersebut.
So the bridging one area with the other area without disturbing the associated area, because I want to create a bridge from ear to ear. But I cannot disturb these areas. If I disturb these areas, the whole body will become deficit. So there should be a direct relation from this to this. And this relation is established with the help of different types of stimulations and different types of voltage. So when you give this correct stimulation in this area with the right voltage to correct stimulation in this area, automatically the signals from here will communicate from here without disturbing these areas. This is called the bridging of the brain, or called the brain mapping. Bridge. You know what is a bridge? Connecting one area to the other area
Bridge, yes.
without going in the river. So without touching these areas, you have to stimulate this area. So you have to create a bridge from here, 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 and from here you come here. And when this tree supports this area, the visual area will recover, and then you can recover -25 to -2, and you can recover retinitis pigmentosa, visual, all types of glaucoma, all types, many types of eye disease. You can just recover by brain stimulation.
Dan jika kita ingin mengobati area visual association ini dari bagian yang terkoneksi dengan itu, kita harus menciptakan jembatan yang melewati bagian-bagian lainnya. Karena kalau bagian-bagian yang lainnya juga terkena stimulasi, maka bisa menimbulkan masalah lain pada tubuh. Maka kita menciptakan jembatan ini atau yang disebut dengan pemetaan otak. Jadi kita bisa menghubungkan sinyalnya dari kedua area tersebut tanpa melewati bagian otak yang lain.
Now we should...
Jadi melalui cara ini kita juga bisa mengobati berbagai masalah mata seperti mata minus, glaukoma, dan lain-lainnya.
Correct. So for example, for example, now you want to recover paralysis, but then to recover paralysis, we need certain neurotransmitters, we need certain neurohormones, we need certain hormones immediately inside the body. But some hormones are generated by the stimulation, but other hormones has to be generated from the limbic cortex. This is called the limbic cortex.
Jadi kalau kita ingin memulihkan kelumpuhan, maka kita harus membutuhkan reaksi hormon dan neurotransmitter tertentu, dan reaksi ini bisa kita dapatkan dengan mensimulasi bagian limbic system ini.
So when I said I did my research on neurobiology of Allahu, this was the area where I understood Allahu works very well. So when you speak Allahu in a proper way, in a very nice way, this area gets very nicely stimulated. And because of this area, the communication goes to corpus callosum. From this corpus callosum, the external brain stimulation and the internal brain stimulation, they mix up in this area called the visual cortex, and then they visualize certain things inside the brain. And when they visualize certain things inside the brain, the repairing of the brain starts taking place. And this repairing recovers the brain and it becomes neuroplasticity.
Bagian otak ini bisa mengalami reaksi jika kita mengucapkan kata Allah. Jika kita mengucapkannya, maka terjadi berbagai reaksi yang menyebabkan kita bisa memvisualisasikan suatu hal tertentu, dan kemudian bisa terjadi neuroplastisitas.
So this is called the coronal area of the brain, coronal section, corona.
Ini adalah bagian koronal dari otak.
No, it's a sagittal, I think it's a sagittal, I forgot. It's okay.
Sagittal.
It's a sagittal or coronal. Yes, maybe a sagittal, okay. Now you can see, this is a caudal plexus, this area, which manufactures the CSF fluid, this area.
Ini adalah caudal plexus yang menyimpan cairan otak dan tulang belakang.
August, do you remember there was one person who said, I have a lot of angerness with my father, and because of that I could not sleep inside the night, and now I have a lot of brain disease and I have a lot of problems in my body. Do you remember that boy in Indonesia,
Yes.
Jakarta seminar? Do you remember that?
Yes. Yes.
Yeah. Because he did not sleep properly in the night, his brain temperature was high, and this is the caudal plexus which did not manufacture the CSF fluid. Since the CSF was not done very well, it could not clean the brain area. And since the brain area you could not clean, the first thing what you have to see the temperature of the genital, whether the right genital, left genital, the lower part of the genital, the upper part of the genital has the equal temperature or not. If there is an imbalance of temperature, that means there is an imbalance in the flow of the CSF. And because of the imbalance in the flow of CSF, you suffer from lot of disease. And this is called, what? This is called the improper working of lymphatic system, and the brain degeneration starts, and then the patient gradually enters the stage of paralysis.
Jika diperiksa pada tubuh seseorang bagian genitalnya antara kanan dan kiri temperaturnya tidak sama, maka menandakan di daerah otak, di cortex ini cairan otak dan tulang belakangnya tidak seimbang antara kanan dan kiri, sehingga bisa menimbulkan berbagai masalah, dan dengan perlahan otak bisa mengalami degenerasi dan tidak lama bisa menyebabkan kelumpuhan.
So this is called the hippocampus. This area is called the hippocampus. This area is associated with the memory of the brain. So one neurosurgeon, what he did in earlier days, he wanted to recover the seizure. Seizure means epilepsy. So what he did, he removed this area of the brain. He did operated this area and he removed it. The seizure was recovered, but what happened? This boy lost all his memories. Now, if you want to make him remember 1, 2, 3, 4, 5, 6, then to repeat it again. 1, 2, 5, 6, 1, 2, 3, 4, 5, 6, 1, 2, 3, 5, 6, 1, 2, 3, 4, 5, 6. And then after some time, we forgot what is 1, 2, 3, 4, 5, 6. So whenever there is a damage in short-term memory and long-term memory, this is the area which is damaged called hippocampus. So to recover hippocampus, you have to stimulate another area of the brain. Then neurogenesis, angiogenesis will recover the stimulus. A proper stimulus will give recovery in the hippocampus, and even the lost memory can be recovered.
Area ini disebut hippocampus yang mengontrol memori. Pernah ada seorang dokter yang mencoba memulihkan penderita kejang-kejang dengan menterapi area ini, tapi yang terjadi malah penderitanya itu kehilangan ingatannya.
I just 1 minute ago, I had to change my position. It's a very severe pain right now. 1 minute, huh? Just give me 1 minute, please. Excuse me. Ya Allah. Just 1 minute. Ya Allah. Yeah. Just 1 minute. I'll take some water. No break. Just I need 2-3 minutes. It's always a regular routine. Don't worry. Don't worry. I'll not take any break. August knows I never take a break. Just 1 minute I was. No, it's okay. I'll continue my class. We have to complete all this syllabus. We don't have much time. Otherwise, everyone will blame me. I never take my class. This is my responsibility. I will do it. So see, now, if you create a proper CSF, if you allow the proper secretion of CSF inside the brain. And that is why I said we have taken out one new method of scalp acupuncture we call cerebrospinal physical stimulation. So by stabilizing the cerebrospinal fluid and giving it a correct pathway by proper stimulation, see, everything inside the brain works with the signal. So if you give a proper signal in the right way, in the right direction, then the stimulation in the choroid plexus will occur. And because of the stimulation in the choroid plexus, who was under manufacturing the CSF, like in your case also goes, there's little less manufacturing of the CSF. And so you could see your hand muscles and everything was wasted. So after some time, when the hand muscles are wasted, you cannot even catch a needle. Your gripping power will become less. And that is what we were worried, that if you do not correct your brain stimulation, if you do not correct your body areas, you will not be able to catch a needle, or you cannot catch anything like that. Can you see my hand, Agush?
Yes.
You cannot grip this area like this. See, you cannot grip it like this because the muscle is vested in this area, so it will become like this. If you see your hand, this muscle is vested, this area is vested, this area is vesting. Now, when you do like this, after some time, when the whole muscle is vested in 3 or 4 years, it takes around 3 to 4 years, but then you cannot hand your hands like this, or you cannot catch it like this. You cannot hold a needle because it will become like this. So it will be like this, or it will be like this. You cannot do it like this. So that is the biggest difficulty. If you do not know what is the progression of the disease, in how many years it will destroy, you may do a wrong calculation and you may destroy the body. Yes.
Daerah choroid plexus ini kita yang berisi cairan dari tulang belakang dan yang produksi cairan otak dan tulang belakang ini harus diseimbangkan sirkulasi cairannya agar tidak menimbulkan masalah. Banyak masalah yang terjadi karena sirkulasi dari cairan CSF ini terganggu. Jadi kita harus memberikan stimulasi supaya sirkulasi cairan ini bisa lancar dan banyak masalah bisa terpecahkan.
So one thing I can tell you, when you understand brain stimulation, proper brain stimulation, you understand where to give stimulation in the motor point, which motor point has to be used, and which area of the brain is to be used, which area of the brain can recover. I can tell you, you can recover many things on the table in just 2 minutes, 3 minutes, 10 seconds, 30 seconds. But you must know where to do, what to do, and how much to do.
Jadi kita harus mempelajari bagian otak ini, kita harus tahu bagian mana yang harus distimulasi, berapa banyak stimulasinya, dan bagaimana caranya. Jadi dalam hitungan detik kita bisa melihat hasilnya.
So now you can see, if you want to recover the hippocampus, you have to stimulate near the those areas which passes through the nerve tract, and then you can see the dentate gyrus is associated with the hippocampus. So when you see this is a dentate gyrus, which is associated with the hippocampus here. So they have a central pathway, but the pathway can be created from the center to here and from here to hippocampus. And if you do this, you can. August, do you remember one patient which Hedy bought? Hedy, do you remember Hedy?
Hedy.
The Chinese boy was my translator.
Yes.
Before you, there was one Chinese.
Yes.
He brought one old man to my clinic, our clinic. Do you remember? Who was very violent and who had sexual abuse at night. When he was young, he was sexually abused. Do you remember that person?
Yes, I remember.
Who was a car mechanic and his son is now a jeweler. Do you remember?
Yes, I remember. He's very irritated, easily irritated.
Yes, very irritated patient. Yeah, you know why? Because of this area of the hippocampus. He remembered only those memories, right? Past memories. But he forgot the present memory. That is in the clinic, we are like this. He only remembers that old gentleman who was his enemy. He remembered all those old things, but he forgot all these new people. Correct?
Bagian hipokampus ini yang menguasai ingatan dan terhubung dengan yang terjadi di sini juga. Pada seminar dulu ada pasien yang mengalami kerusakan di area ini, jadi dia sangat mudah sekali marah karena dia kehilangan memori, dia hanya bisa mengingat memori ketika dia mengalami disakiti oleh orang lain, dia tidak bisa merasakan bahwa dia sedang berada di klinik, sedang diobati. Jadi dia terus-terusan merasa marah.
So, 1 minute. Someone is making noise. So you can see, overall, this is the brain anatomy. This is the olfactory area. So now, if you have a lot of problem in smelling and other things, this olfactory association area helps you. So each area of the brain, if you see, has a functioning, it has a support, it has a functioning, it has its own pathway. You can see this pathway. The cut of the corpus callosum, you can see. Yeah, see? Tell. Just say in the summary.
Setiap otak memiliki banyak bagian-bagian sendiri dan tiap bagian memiliki fungsinya dan bagian-bagian yang mendukung sendiri.
You asked me why, see, right commands the left and left commands the right. You told me this question. You remember in my room, you told me this question, you asked me this question?
No, maybe it's another person.
No, you were the person. Yeah, wait a minute. When you came in my seminar room, there was one professor here. Do you remember of pharmacology? With the specs like this? Do you remember the professor in the room in Jakarta, in my hotel room?
Who is he? I don't
Yeah,
remember.
there was, you forgot. There was a professor of pharmacology who used to see like this. Like me. He was a professor of pharmacology. And then there was a internal medicine doctor. I forgot her name. I used to call her GP36. So this is GP7, General Practitioner 7. So you also were there. You asked me.
Ismail, Dr. Ismail?
Yeah, Dr. Ismail, correct. Dr. Ismail, correct. You said, no, he was not there. He was sitting in my room. You were also sitting on my bed. I remember everything. I only wait for the right opportunity to teach you. That's it. You asked me a question here, Dr. Ismail, and it was 11:30, 2 days after the seminar. You asked me that I insert the needle on the same side of the stroke, because right side commands the left and left commands the right. Correct? But why do I put the needle on the same side? This side paralysis, this side only I put the needle. Why? Even Dr. Ismail asked me the same question. I said, okay, this is because I give the communication from the corpus callosum.
Ada pertanyaan kenapa saya menstimulasi bagian yang sama dengan stroke padahal dari kelumpuhan, padahal bagian otak kanan menguasai yang kiri dan bagian otak kiri mengontrol yang kanan. Ini karena jawabannya adalah karena saya stimulasi corpus callosum ini.
So there is a certain area of the brain which can stimulate the septa pellicuda.
Kita juga bisa menstimulasi ini dari septa pellucida ini.
First, you must know which area of the brain can stimulate the septa pellucida.
Pertama kita harus tahu bagian mana di otak yang bisa menstimulasi septa pellucida ini.
So if you know that, what will happen, you know? you can recover the patient immediately with the treatment.
Kalau kita tahu, maka kita bisa memberikan hasil instan pada pasiennya.
So you can see the fissures, folium, gyrus, cortex, arubata vitae. These are different anatomy of the brain which you can study.
Ini adalah berbagai macam bagian otak yang bisa kita pelajari.
So here you can see this is a duometer.
Ini adalah durometer.
So when you give the who is talking? So now you can see this is the duometer. This one. So
ini adalah durometer.
So even in the there is CSF near the duometer. Now in between this and the skull there is a CSF, cerebrospinal fluid. Because of this, which is manufactured here. This 990-83685. Please mute your mic. Please mute your mic. It's done twice. After every time he does. Okay, removed. I had to remove him. Sorry. If you switch off your mic again and again, and I switch it off, how much disturb you are doing to the whole class? Why to keep you? So now you can see this is the corpus callosum. This area of the brain is the other area, and this is the other area. So this area, you transmit information from this area to this area. So it is called direct bridge. So this is the area which feeds the lateral ventricle. So this area, they stimulate the from the cortexes, the CSF is done, then they go in the certain pathway, and then this area is called the cerebrum from the occipital cortex. So whenever there is a pain in the coccyx area, you can stimulate this area, which is just near the cerebellum. So the moment you insert this needle in the cerebrum area, endorphins and corticosteroids are released for the coccyx area. The moment it is released, the patient gets immediate recovery. So it is said, whenever there is a pain in the coccyx, go to the eye of the brain. So it is called the occipital protuberance. Speak. You know where is the coccyx area? The last bone in between the buttock. Speak.
Ya, kalau kita ada pasien yang bermasalah di bagian coccyx area, kita bisa mensimulasi lewat bagian cerebellum ini.
Yeah, here. In between the gap between the cerebellum. Right? So all this I have told you. This is called the lateral ventricle. This is called the third ventricle. This is, you do not need so much. For non-invasive brain stimulation, you don't need. This is much required by a neurosurgeon. But you can see the third ventricle, the anterior of the third ventricle. This is a central canal. This is the lateral ventricles. You can see. This is the horn. Yes, I told you that. Wait a minute.
Sorry. Can you hear me?
Just give him some time. Give him some time, please. He's coughing. Maybe he's vomiting now.
I just offline. I just came back. Sorry. I don't know. I just offline. It's disconnected.
Oh ya, Sastry
Yeah, I'm
sudah
there.
Just
masuk.
come back.
Yeah,
just
yeah,
come
I'm
back.
here. I'm here. I'm here. Don't. Oh. Just give me 1 minute. Let me stabilize myself. See, whenever you have nausea, you just take a good smell of a rose or something and the nausea goes down. So I use this from the aromatherapy. So whenever I have so much vomiting tendency, I just smell rose and the vomiting goes down. This is all because the brain stimulation. You can stimulate the brain from various things. You are there or gone? Chen is
Yes,
there or
yes.
gone? Okay.
I'm here.
Hey, you are my kid. You should say, Father, I am here. Sir, no, Father.
Yes, Father, I'm here.
Yeah. So here you can see this is the caudate nucleus, the third number. So see, the meaning of teaching you this class, I don't know why it is not okay. So this is the optic nerve. You have seen me inserting needle inside the eye and trying to create a game inside the brain. It is because of the optic nerve stimulation. You can see this. So with the help of optic nerve stimulation, I can work with the third ventricle, I can work with the thalamus, I can work with the hippocampus, and I can also work with amygdala. This is the amygdala. So I can work by inserting a needle over here, just here, the eyeball, I can stimulate the optic nerve. From this optic nerve, I can enter inside the brain in various ways.
Diapole. Dengan menstimulasi bagian yang diapole ini, kita bisa menyampaikan simulasinya ke berbagai bagian lain di otak.
Over? Bagus? Bagus, over?
Over.
So here you can see this is the brainstem. If there is a stroke near the brainstem and some damage inside the brain near the brainstem, especially because of spondylitis, if there is a nerve damage and cord stenosis, means if there is a edema in the cord, you can see this area of the brain is damaged, and then the brain may it may stop the lung, it may stop the heart, it may damage any part of the area, and even if it may lose the memory, it may lose the eye. So because of spondylitis, you may have lot of problems inside the eyes. We call this cervical spondylitis, long-standing compression. Because of the nerve compressing, you may damage the brain area and also you may damage the brainstem.
Bagian brainstem ini jika rusak maka bisa mempengaruhi banyak hal seperti dari pernapasan dan fungsi lainnya. Masalah pada cervical kita jika mengalami spondylitis bisa merusak juga bagian brainstem ini, pada akhirnya bisa menyebabkan berbagai masalah.
So now you can see the fornix, the brainstem, the hippocampus, all these things okay. Now here you can see one thing. This is the area which connects with the spinal cord. So whenever there is a problem in the spinal cord, canal stenosis, this is the where I told you, because you are a long person, you bend and you see. This is the area which you have damaged because of the spinal cord. You damage the fourth ventricle. Because of the damage in the fourth ventricle, you damage the cerebral pedicles. And since there was a damage in the cerebral pedicle, you also damage the lateral ventricles. So since you damage the lateral ventricles, what happened? There was a lack of manufacturing of the CSF inside the brain. And because the CSF was less manufactured, lot of problems inside the brain occurred, and you were always angry with your father. That's it.
Jika ada masalah di sumsum tulang kita, maka bisa mempengaruhi ke cerebral pendacos dan kemudian mempengaruhi ke bagian-bagian lainnya sehingga jika jadi sekresi dari cairan otak dan tulang belakang itu berkurang dan akhirnya muncul
Over. Agush, can you hear me?
Yes.
Can anyone? Yeah, okay. So this is, you say, whenever there is a spondylitis, they also try to understand there is a high chances of having what? Trigeminal neuralgia. So this is the trigeminal nerve. So what I said, if you can work with the MVI, what you call it, microvascular decompression. So when you can say microvascular decompression, you can work with what? You work with, surgically, you work with the trigeminal nerve. It means you create a cushion between the triggering neuron and the trigeminal nerve by microvascular decompression. So same thing, without neurosurgery, we can do with acupuncture. This is what was told to me by whom? By Dr. Udipong, who was a neurosurgeon, who did his MVI, microvascular decompressions and all. He did it with what? With just acupuncture nerve pathway. Dr. Udipong is a very senior neurosurgeon from Thailand, and is a very senior, he's called the god of tumors in Thailand.
Yeah, very long. Bhumika, can you help me translate this one?
Okay, I explain you. This is called the trigeminal nerve. Speak. This is the
Ini adalah saraf trigeminal
nerve. Trigeminal nerve. Trigeminal neuralgia occurs from this nerve.
Trigeminal neuralgia terjadi karena masalah di saraf ini.
Yeah, there is a triggering neuron nearby this area, which creates a compression, which irritates this nerve, and because of this, trigeminal neuralgia occurs. It's a neuron.
Terjadi dekompresi di neuron ini yang menyebabkan masalah pada saraf trigeminal. Okay, what's next?
Yeah. Now, there is a Dr. Udipong from Thailand, who is a god of tumors, and also is a neurosurgeon. Dr. Udipong is one of the very senior neurosurgeons from Thailand, Bangkok, and he is working in Pusat Institute of Neurosciences.
Dr. Udipong Udipong dari Thailand adalah ahli bedah saraf yang terkenal dari Thailand dan bekerja di mana tadi? Pusat persarafan lah. Di suatu pusat penelitian saraf.
No, neurosurgeon. He's a neurosurgeon. He's a neurosurgeon.
Yes.
Yeah.
Yes, I already said.
So it is. He is a famous person who does microvascular decompression, and also with the help of acupuncture, he has recovered large number of people from trigeminal neuralgia without surgery.
Dia menggunakan dekompresi mikrovaskular untuk mengobati trigeminal dan juga dengan akupuntur untuk mengobati trigeminal neuralgia tanpa operasi.
See, MVD, he says that in MVD we have a what? We open the carina of the bone. We do craniotomy, and then we go inside the brain and we create a cushion in between the trigeminal nerve and the triggering neuron. Cushion means something in between.
Biasanya dalam operasi kita menghubungkan antara I'm sorry, between what and what?
Between the triggering neuron, the neuron which is compressing the nerve, this trigeminal nerve. So in between you and me, I created a third matter.
Neuron pemicu dan
one minute. Hear me. In between you, you are the nerve. I am the triggering neuron who's giving always pressure in between you. So what did you do? You brought Mickey inside. This process of Mickey coming inside between you and me is called microvascular decompression. You understood?
Okay.
Yeah.
Jadi menghubungkan antara neuron pemicunya dengan saraf trigeminal.
So with the help of acupuncture needles or dry needles, when you can work with cranial nerve 5 and then the cranial nerve 4, and if you create a typical pathway, you can even recover trigeminal neuralgia, and you can create the same microvascular decompression with the help of the dry needles.
Hanya dengan akupuntur kita bisa memberikan hubungan antara saraf kranial dan juga memulihkan trigeminal neuralgia.
So you can say by regular compression in the nerve in the cervical area, many persons suffers from trigeminal nerve neuralgia. This is the area of the trigeminal neuralgia. This area.
Banyak orang yang memiliki masalah dengan bagian lehernya bisa mengalami trigeminal neuralgia.
There is only one treatment for the trigeminal neuralgia is Botox, but then we have recovered many patients with SNIT, sustained neural injection therapy, and brain stimulation. We have recovered large number of patients of trigeminal neuralgia, and also Dr. Udipong has done the same.
Terapi untuk memulihkan trigeminal neuralgia adalah biasanya dengan Botox, tapi sekarang digunakan Sastry neural injection terapi dan juga brain stimulation, simulasi otak sudah bisa memulihkannya.
Now you can say this is the facial nerve. By slapping, you have seen sometimes I slap people very badly when they have a black pain. So you can see how slapping stimulates the facial nerve and stimulates the spinal cord, brainstem. And from this, lot of endorphins and corticosteroids are released, and as a result, nerve compression is released. So by slapping the people also you can recover, provided you know how much you have to slap.
Dengan kadang kita bisa melihat Master Sastry menampar pasien karena dengan memberikan rangsangan pada saraf wajah maka bisa meneruskan rangsangannya ke saraf di bagian otak yang lainnya.
Yeah. Now you can see this is the glossopharyngeal nerve. Now, when you stimulate below the tongue, you work with the glossopharyngeal nerve, which is the cranial nerve 9. So when you work with the cranial nerve, and then when you work with the cranial nerve 8 and vagus nerve from the ear, you have seen many times we put needles in the ear, this area. It is called the vagus nerve of the vagus nerve branch. So when these branches of the nerve you stimulate, you can even recover the voice aphasia by putting some needles in the ears, giving brain stimulation, and using a couple of motor points.
Dengan simulasi dari saraf vagus ini, kadang kita bisa memulihkan kesulitan bicara.
So this is the pineal body. This is the pineal body, pineal gland. You can see. So
Ini adalah badan pineal.
Yeah. So same thing is repeated again and again. So here you can see how we work with the brain stimulation. I gave you some narrow concept about the brain anatomy. Tomorrow also we will go with brain. How much is the time? Let me see. Oh, we have just 1 hour more. We can give some more concept. But that Dr. Chen wanted to ask me some question. Dr. Chen, are you there? Dr. Chen, come in. Dr. Chen, come in. Oh no, Dr. Chu. Dr. Chu. Dr. Chu is here. Dr. Chu, are you there? Dr. Chu, you are there? Dr. Chu? Dr. Chu, are you there? Dr. Chu, let me call him. He had a question. Dr. Chu, you can ask me the question. My lecture is over. You can come online and you can ask me. No, you can you come online, because others will be happy if you can, they can hear your question.
He's not online, sir.
I also have a question.
One minute, Dr. Chu, I call up Dr. Chu. Yeah. Yes, Dr. Patel, you can ask me. Till Dr. Chu comes.
Yeah.
Yes, tell me.
Yeah. My question is, can we recover non-malignant brain tumors with our method?
Madam, see, it is very difficult to, as of now, we certify whether this tumor size of the tumors can be decreased by the help of brain stimulation.
Okay.
But certain types of endocrine tumors can be recovered. Certain types of tumor we have recovered. But we do not know how many types of tumor we can recover. So we are selective in this type of cases, because our first option is surgery. If surgery is not done, then we go for the treatment. Because the question is that the size of the tumor continues to increase. It is progressive in nature.
Yes.
And if by chance a tumor bursts, or it compresses the nerve, or it does some damage in the body, it may be a permanent deficit. So in order to overcome this risk, we advise the person first to go for surgery. Once the tumor is removed, then we'll try to recover the damage. And that can be done easily from the treatment.
Okay, thank you.
Dr. Chu is there? Dr. Chu? Dr. Chu? Dr. Chu is there?
Hi.
No. Dr. Chu, can I see your
Can you hear
face?
me?
Yeah, I can hear you very nicely, my brother. It's a beautiful. You are still very young and handsome, more than us.
No, my question is.
Yes, tell me.
Just now you talk about connecting, creating a pathway from one area to another area. During the stroke, let's say a portion of the brain already damaged. I mean, from my understanding, generally the brain cell will not grow anymore. So how do you actually create the pathway to connect one to another?
Brother, where it is written the brain cells will not grow, the concept is already given. Angiogenesis and the concept of neuroplasticity in stroke is already mentioned. I have recovered more than 500 million population in my life of different types of strokes. And with my experience, I can easily say it's a very easy matter. Whatever 70% cases of the stroke can recover. And the cost of the treatment is less than $1. This is what I was saying over phone. Where you are running with aesthetic medicine, the stroke clinic is very fine, because you spend less than $1 for the treatment and you recover the lot of stroke cases. And this concept is called neuroplasticity. In our medical science, the concept of this neuroplasticity was hidden, because the people did not know how to stimulate the brain without touching it. They never did the brain mapping. They never studied the brain anatomy very carefully. They did not associate the eye visual cortex with the motor cortex. They only thought one way: if the motor cortex is damaged, now there is no possibility of recovering. But then you see, I have evidence, an open evidence, where all my seminar students have seen that we have recovered the paralysis patient by 80%, 90%. And even we can recover spinal cord injury, quadriplegia, which everyone says after the cord damage, you cannot recover the patient. But then just by brain stimulation, we have repaired the cord after surgery, we have recovered the nerves, and now the patient is doing fine. If you want to understand this, you can also, I'll give you a group link, but I have this one video, which is very famous of mine, in which there was no chance of recovery. He had multiple fractures and injury, one in cervical and one in dorsal area. So this patient was totally quadriplegic and there was voice aphasia. And I just treated him 3 days, each day, 3 hours by my juniors. And I only treated him how many days? I just treated him 9 hours in 9 days, you can say. In just 9 hours of treatment, in 3 days, each month, 40 days. After 40 days, we took this patient for 3 days, 3 days, 3 days, 3 days. That is only 9 days. And then I taught these techniques to his wife. His wife recovered this patient. And now the patient is totally stable. He's walking. And then I can give you the group link also. Wait, I'll give it the group link. You can see. So this is what I say. When I am speaking because of my experience that we have recovered these cases. 1 minute. You are there, Dr. Chen, or you ran away? Dr. Chen?
Yes, yes.
I'm here.
Chen is okay. Dr. Chu?
Yeah, I'm here.
I thought you also ran away by my boring lecture. You see, I'll give you a link. Wait a minute. I'm here. Spinal cord injury. I'll find out you a link and I'll give you in which I have recovered many patients of spinal cord injury, and even this student of mine who have been recovered the spinal cord injury. I'll give you his link right now. This patient came to me in Delhi seminar. It is my seminar where he came, and you can see how he started walking. I gave you this link in your WhatsApp. It's a spinal cord injury. And when he came, he could not even walk. Wait a minute. I'm giving the link in the Zoom class. Yeah, you have seen that, correct. I've given it. Yeah, and then you can see, if you see in my lectures, in my practical seminars, I always trying to bring this type of patient who are very seriously sick or they are having a lot of problems. I call them from all directions. I always tell the people, I even told you that you recover all these patients, which patients you cannot recover. You bring it to me and I'll show you how to recover them. That is what I said. Aesthetic medicine is good. By giving brain stimulation, by doing all this, you can do anti-aging. You don't need to create Botox from external side. You can give Botox from internal body, even in the brain. Brain has the capacity to generate all this hormones, neurotransmitters. You can make the body beautiful from the brain stimulation, you see. Yeah, you can make your face beautiful from a brain stimulation by the dry needles. Instead of giving Botox, why do you give so risky medicines? There is no legal complications. Why to take so costly treatment like NIBS? Pardon me?
Need to learn more from you first.
Learning is a easy concept. See, you are also learning, but in between you get bored and you go out from the classroom. That's what I can do. But then you see, learning is an easy concept because what you have not learned in so many years, just you revise and everything comes to your mind and just create a pathway and the topic is over and you can recover the most critical problem. You can recover the eye disease, you can recover the ENT problems, you can certain types of tumors, you can work with motor neuroma, there's a benign tumor in between the feet, you can recover large number of painful conditions, you can recover neurofibromyalgia, you can recover spinal cord injury. You tell me what you cannot recover. As a GP, you cannot recover fever also, but as an NIBS specialist, you can recover large number of brain damages. Ask one more question, Dr. Chen. Asked, it is very important question you asked me. So ask couple of questions. I want to answer you. Dr. Chu?
I got no question.
Ask one more question for my sake. Just ask whatever you like to ask.
I have a question.
1 minute, madam. Dr. Chu wants to put a question. Then we'll take it.
No problem.
Dr. Chu, please speak.
Hmm?
Yeah, please speak.
No question at the moment. Just now, that is the only doubt I have regarding the pathway.
See, one thing I want to tell you, one thing very well I want to tell you. If one area of, say, for example, your and my relationship is spoiled, right? It is not a permanent spoil of the relationship. If a mediator comes in between, who is close to you and who is close to me, he can bring us back to our good relationship. And that is called neuroplasticity. Joining a good relationship by using a third mediator. If you are spoiled and I am spoiled, if I speak you something, you will not hear me. And if you speak to me something, I will not hear you. This is called a stroke damage. Now, if you bring a third party in between, who is close to you and also close to me, you can reestablish our relationship. And this reestablishment of relationship is called neuroplasticity of the human brain.
Okay.
Am I clear?
Yeah. Thank you.
Or do you want to ask some more? You have some doubt in it.
No. I think other member have.
Yeah. They were, no. It's okay. Everyone can ask me questions, but then you are more important to me because I caught you from the wrong number. Because of your, you were invited by me, but they came by themselves. So when I speak about you, I just caught you from the road. I said, "Hi, Cheng, how are you?" And then I put you back to my class. You were not self-guessed. They are self-guessed. But you were caught and bought in the class. This is a story between Chu and me. He gave a post in the Facebook. I said, your Facebook was hanged. And then I gave him a phone call. And from this phone call, he said, I don't know anything. I said, I'm starting my class from tomorrow. You come to the class. He said, how to attend the class? I said, attend the Zoom. And then from the wrong call, he became my student. Anyway, Dr. Patil, ask me what you want to ask.
Yeah, so this is a very basic question. What can a normal person do to maintain a proper manufacture and circulation of the CSF, or maybe a good brain function?
You should always smile, always laugh, always do. You must enjoy your life. The best thing is to enjoy your life. I always tell the people, you are sick because you always think like a sick person. Now you go and enjoy your life. Do clapping, do laughing, do sleeping, do yoga, pranayam. You do whatever you like and you enjoy your life.
Okay, that is
And
basically be positive in life.
Not positive. If you try to be positive, the negative thoughts will come.
Okay.
See, wherever you try to force something, the opposite things will take place. So do not force anything. Let it go naturally and you will do things very nicely.
Okay. Thank you.
Dr. Chen, anyone more questions, please?
Sir, Dr. Chandrakant here. Sir, how your voice commands work here, sir?
Voice command works here. Yeah. You are asking such a dangerous question. I never expected this question to come here.
Because always, many times we see you don't use needles, you don't use any, but you use voice commands and recover the patient.
See, what I do is similar thing. If you do with the friendship, 1 minute. There's so much voice. Chandrakant, you first switch off this TV. People are speaking from behind. I cannot hear you. Now, can we talk, Chandrakant? Dr. Chandrakant, can we talk right now?
Yes,
sir.
Yeah. Actually, I'm coming into the other room. So when you want to use your voice command, you have to become very friendly to the patient first.
No. See, friendly to the patient is never required. You must be friendly with the brain. Once you are friendly with the brain, the patient will also
brain. Okay.
Yeah, you must be friendly because all the patients. 1 minute. All the patients who come to me are most negative patients of the world. Even if you see, Agus is the most negative person for me in the world, because they will never hear me, they will never understand me, they will never know what I am thinking, because I think like a neurophysician, I think as a neuroendocrinologist, I think like a neurophysiologist, I think like a neuroanatomist. So my way of working is very different. I can even recover with a finger touch. I call it feather touch, just to like this, and you can see the lot of stimulation in the nerve, in the body.
Okay.
You don't need to, even I don't need a needle also, I don't need a pain also. But just with the voice command, I say Bismillahirrahmanirrahim. If I say in the ear, in a very small voice, you can see stimulation in the body. But before that, you must be able to say the friend. It is just like you and me. When you are stranger to me, I ask you a purse, will you give me? No. Will you give me a shelter in your house? No. But since now we are very good friends, even I am coming to Hyderabad without money, you are telling me everything will be arranged. And this is called brain command.
Okay.
So,
Good. That
so
answer,
when you are
that
friendly with
actually
them,
clarified my doubts.
yeah.
Brain.
So when you go with the brain signals, yeah, when you go with the brain signals, and brain signals identifies that he's my friend, it will allow you to come to his territory. And once you allow to go inside his territory, whatever you speak, either from your voice or from your hand, from your finger, it will follow you just like a best friend. That is why I say brain is your best friend, brain is your best enemy. If you give a wrong stimulus from the wrong pain, for example, the Chinese pain people are buying in the market, and they give a stimulus in the brain, a wrong stimulus. What will happen? If I say you, "Oi bastard, hear me," will you hear me? No. You'll fight with me. You'll fight with me. But if you work with the proper stimulus, you can recover the most critical problem of the brain.
These are very tricky small things, but you are putting it in a very easiest way to make us learn.
See, Chandrakant, the research means what? The research means that you go with a very critical pathway. But when you know the road, you must make it easy for others. It is not necessary that I make a tough road for you to go for this. The path
No,
to
you
recovery
are
is
creating
very,
GPS for us now.
yeah, every part has to become a GPS, because everything has to be recovered very easily, very nicely. And when you recover things easily and nicely, then medical science becomes easy for practice, and lot of people can recover. You cannot make things complicated. Rather, you have to make things easy for others to recover.
Sir, one more question.
And thank you, sir.
Yeah.
One more
No,
question.
Chandrakant, please, 1 minute, madam. Let Dr. Chandrakant speak. He's one of my best friends.
Sure.
Madam, just give me 1 minute.
Sure.
Chandrakant, please speak.
Thank you very much, sir.
Please don't mind. I'm a man. 1 minute. I'm a man of relatives, right?
Oh, yes.
So I always give chances to my family member first, outsiders later on.
So now I am also your family member.
Madam, but you're third in the row. Chandrakant is first in the row.
Okay.
Now, being a maxillofacial surgeon, we work along with neurosurgeons, we work with ENT surgeons, but we have taught, without brain, we have learnt dentistry. After becoming maxillofacial surgeon also, brain was not in our chapter, actually. Today, first time, I have gone to the basics of the brain, how you can help a patient. Thank you very much.
Sir, one thing I tell you, any damage inside the body, 1 minute. Any damage inside the body is brain damage, and any recovery is from the brain. So until unless you recover the brain, you cannot recover even the constipation also, you cannot recover acidity also, you cannot recover any disease of the world. You may reduce the symptom, but then it will come up in other form. So any damage inside the body is a brain damage. Now, if you want to recover that damage, you have to recover the brain. So it is very easy to recover the brain. Just put some dry needles, put some stimulation, and the brain recovers.
Thank you, sir.
Sir Chandrakant, sir, we were talking about something which who has a voice aphasia with hemiplegia. So
yes.
Among these things, before leg and hand, so do we can recover the voice aphasia? We were discussing about this, no, sir?
Yes. We were discussing first whether we have to recover the aphasia or this thing.
No, that is what. So yes, sir. So we were having a doubt that so before the lower limb and upper limb, do we can recover the voice aphasia first?
Yes, that is what we had it. Let us ask, sir.
Yeah. Now, one question I'm asking you: without becoming my friend, can you take knowledge from me?
No.
Huh?
We have to first become friends, and then we have to have communication.
This
Yeah,
is your
the
doubt
brain
only,
is
sir. Sir Chandrakant sir, this is your doubt only. I was very clear with this. This is Chandrakant sir doubt only.
See, Sinesh, it is not only Chandrakant doubt, it is everyone's doubt. See, without making the hand and leg walk, brain will not hear anything from you. If I don't give you
Okay,
any
okay.
income,
That's very clear, sir.
no,
Very clear, very clear, very clear. Thank you, thank you.
one minute. No, thank you. Let me give the explanation to others also. See, when I went to Hyderabad, there was an expenditure of more than 100 jutas, 102, around 200 jutas we have spent, not 200, 150 jutas. That is around 9 to 10 lakh rupees was spent in Indian currency. If I would have created a loan on everyone, if I have not done a proper planning, will people have confidence on me? No. What will happen? It is called deficit. But if you do with proper planning, if you generate a total income and from 20 patients or 30 patient income, if you recover 700 patients, what will happen? You know this way of recovery that you can, by just 20 patients income, you can recover how much people? 700 people, or 30 people income, you can recover how much? 600 people. Now, you can imagine we just earned more than 150 jutas only from less than 30 patients in Hyderabad. And then they paid us how much? 25,000 or in 30,000. That means 4 jutas or 5 jutas per patient. But then you can see, if we include 4 juta per patient into 30 days, into 30, how much? It becomes 120. And this 120 juta is equal to 9 lakh rupees. Now you can understand, 8 to 9 lakh rupees, 130 to 140 jutas. You can earn from 30 to 40 patients, and you can serve how many patients? 700 patients. You can imagine. Let's say income from less than 1% of the patient serves 700 patients. This is called the power of brain mapping. And this is how you can grow in economy of your life also. Just taking the money from only 1% of the patient or 2% of the patient, you can recover how many patients? You can recover 700, 800 patients. And then you can earn how many much money? 150 jutas, 9 lakh rupees. And from this 9 lakh, you can treat how many patients? 700 patients. Now tell me, which is a good business? Your business is good or my business is good?
No, you are helping many people also. In this
Now you
way.
tell me, just taking, yeah, because see, who will give? Did I ask someone to pay me money? When I go to Indonesia, I pay my own tickets, pay my own expenditures. I have a lot of expenditure in Indonesia also. Do I ask anyone? Mickey is there. Mickey is coming. Mickey,
Yes,
can you
I'm
speak to
here.
me?
Yeah.
You can ask me. Yeah, you can ask Mickey. When I went to Indonesia, did I ask any money from anyone in Indonesia?
No, not at all.
Who gave my hotel fare? Who paid for the hotel fare? Hotel expenses?
Actually, you buy it yourself. I know.
Yeah. Who paid me the tickets for Indonesia?
The expenses is all yours.
Yes. Now you see, whenever I go anywhere, my expenses are mine, and income also I generate a good one. But I never bring that income to my pocket. Most of the seminars which are international, I always pay the money there itself and distribute it for their purpose. But I always earn from my patients. So that is what I say. A good teacher needs no money from seminar. He can earn from own practice. So this is what I said every time to you people. Learn brain mapping and you can become the master of many. You can bring brain mapping in such a way that practice becomes most beautiful every day and every night.
You know
More
how to live
questions?
with the brain, sir.
Huh?
You know how to live with the brain
Chandrakant?
and survive. You know how to live with your wife brain.
See, I had no wife. What I will do? I had only one brain to work with. So what I did, I always stimulate. See, you are fucking your wife. I always fuck the brain. So I know only about the brain, not about your wife.
But I tell you, sir, you know how to teach people also. That is very important. It is not that the textbook knowledge or anything books. There are so many. You know how to teach is also more important to make them understand. Thank you.
Yeah, sorry, the connection was wrong. The disconnected. So we are back on road. Anyone more? Any more questions, please?
Me, sir.
Sunita Patil, please, Dr. Madam,
Yeah,
please speak
yeah.
to me.
Sir, again, a very simple question. Age-related brain degeneration. Okay, let's say patients between 75 to 85 years old. Can that be recovered with our method?
Yes. We have recovered large number of people with brain degeneration. We have supported. If you cannot recover, at least we can support the patient with a new life.
Okay.
Nothing like that. You can do a lot of things with brain stimulation. No
Thank
problem.
you. Thank you.
More questions? Roni, any question? Mangla Narayan, any question? Farik, any question?
Sir.
Mangla?
Yes, sir.
Tell
Sir,
me.
you said for visual cortex, we have to not use that area and we have to stimulate other area because it is already damaged.
Yeah. So, for example, you have spoiled your relationship with me, right? You fight
Yes, sir.
with me.
Yes, sir.
Now, do you think if you say me something, I'll hear you?
Yes, sir. No, but
Now,
I have
let
to
us
be
go.
friendly
Now,
with you.
one minute. Let us go to Ahmedabad, okay? In Ahmedabad
Okay.
seminar, there was one Nila Bhai Patel. And
Okay,
then
sir.
he told me, I shouted at him. I shouted at him because he was putting a needle in the lungs. If you would have put a links in the needle in the lungs, that patient would have pneumothorax. And if he had a pneumothorax, what would happen? Mr. Nali Bhai Patel might have gone to jail.
Yes, sir.
So just to correct his mistake, what did I say? Why do you put needle inside the lung? You don't know
Yes.
how to do needle, right?
Yes,
He
sir.
claims himself to be a senior acupuncturist, and now he's putting needle inside the lung. And if I shout, he's saying that I'm an egoistic fellow. I don't know how to speak. Now, since he has spoiled my relationship, do you think that I will? He can anytime come to me, or I can hear you, or he will hear me? Do you think this
No,
will happen?
no, sir. No, sir.
Now, yeah, if you bring Bharat Tiwari in between, and Bharat Tiwari explains me, Bharat Tiwari explains him. Bharat is my mutual friend of me also. He's a mutual friend of him also. Then the relationship can be established or not.
Established, sir.
This is called brain mapping and brain stimulation. Taking the
Now,
third
see,
help to recover the affected area and affected area of the brain. Recovering by the third side is called what? Brain mapping.
Okay, sir. In that case, for instead of visual cortex, where we have to put the needle, sir?
Madam, it is very difficult to say on over this phone because your neuroanatomy is totally zero.
Okay, sir.
You do not know which area of the brain works where. Do you know how brain works with the neuromuscular area? How visual cortex stimulates, V3A stimulates which area of the muscles? Do you know that? V7A
No, sir,
stimulates
not
which
it.
area of the brain? How much impulse you have to give? How much pain do you have? How much impulse you have to understand? See, did you create a stroke clinic in your house? No. How much stimulation you have to give? Which pain has to be stimulated? Do you know the motor nerve? Do you know the motor points? Do you know the brain connecting with the motor nerve? Do you know the brain connecting with the motor area? No. You know anything?
No, sir. In studying, please.
So how do you understand? We created a holography for you. So Dr. NG asked me, why lateral scalp, why this scalp, why that scalp? Yeah, because each scalp creates a neuroanatomical approach with muscular mapping. And through this, I answered the question of Dr. NG in this class. Dr. NG, are you there? NG? Bye, you are there? Bye. You see, Dr. NG is there?
No, sir. No, sir. No,
what?
sir. So half of the members gone.
Ran away?
There is only 50 members left.
These are all. Fami is there. Fami Rashid is there. Fami is my brother. He will be always there. NG may be today.
Today the day is quite light, so I'm quite fresh.
My Fami is my brother is always fresh. Whatever you say, even in the OT room, you are hearing me. I always say my brother loves me more than my wife. Whatever you say, for me, he always looks after me. Anyway.
Thank you, sir.
Anyway, welcome.
Thank you, sir.
What do you call? Mangla Narayan. Yes.
Thank you, sir.
Yeah. Anyone? Any more questions? Yeah,
I
please
have
ask
a
me more
question,
questions.
Doc. Yeah, I have a
Please.
question. I have two concerns, Doc.
Yeah, may I know SCCD is speaking, I think.
Yeah, this is Cindy Lou Benedictos from the Philippines, Doc.
Yes, please tell me.
I have a client who has optic neuritis due to multiple sclerosis. When she came to my place, she could not see. The left eye is total black, and there's a little light for the right eye. And then she, after a few sessions, she recovered. Rather, she uttered she can see my figure, but it's black and white, and the vision is only up to, I think, half foot. So I
No,
use
see, you have to. No,
I
no,
use
no.
brain mapping, and please guide me.
No,
What
no, no, no.
happened?
See, no. The question is first three things you have to understand. Do you have the infrastructure to recover the brain? No. What is the infrastructure you have? Do you have that brain which that pain that stimulus the visual cortex? Do you have? Do you know that stimulus? Where will you create that pulse? Where is the pulse?
Yeah, I use the brain mapping for eye disease.
Which kind of brain mapping you do? Tell me. Which area of the brain will you use to recover the visual cortex 3A? The lower part of the vision of the eye is seen by V3A, V7A, and V13A. How to recover this? How to
I
recover
just
these areas
use
of the
the.
brain? What do
I
you
did not
use?
use. I did not put needle on the eyeball because I was not. I'm not
I'm
ready
not
for
saying.
that.
No. I'm not saying to put any needle inside the eyeball.
Yeah,
Did I
yeah.
mention you that you have to put a needle
No,
inside the eyeball? So you are
no.
saying me
But
no 1 minute. You are saying me you are using a brain mapping. Now tell me
yeah.
which area of the brain did you put the needle?
I used the no. I used the drawing which was sent to me by Doc Danilo Priscilas. I followed it.
See, the problem with you people is that you do not know what is the damage and which stimulation you have to give. I have given you just a preliminary pain for muscle stimulation from the brain. Using that powerful stimulus, small stimulus pain, you are thinking to recover the most critical problem of the eye. Is it possible?
Yeah.
Is it possible?
Yeah, it's possible to recover, but
No, it's not possible. See, you want to eat little rice, and I've given you 10 spoons of rice. Will you be able to eat? No.
no.
You do not know how much stimulus to give, where to give, what to give. That pain can no way work with the brain stimulation for the eye. I told you 100 times in the class also. And not only to you, to everyone in the class. I said, I just laugh in the class. You know why? I always tell the people, none of you can recover any patient in the class because you could not recover for your whole life. And today also after attending the class, you cannot recover the patient. You know why? Because you don't have the infrastructure to recover the patient. Where are the tools? Now you want to do work with the most complicated area of the brain in the eye, which has no treatment in the world. No one can ever recover the brain disease. No one can even recover the eye disease. Now, how to recover this? The problem is with us is that we don't want to know how to recover. We don't have the infrastructure to recover, and we try to recover the brain disease. It's not possible because you do not know which pain has to be used, what is the stimulus of that pain, how, which area of the brain has to be inserted the needle. Every stimulus is different stimulus, every brain area is a different brain area, and every recovery is a different recovery. Just using one map for glaucoma, for retinitis pigmentosa, for posterior cephaloma, for retinal detachment, for the visual disfigurement, it is not possible. You must first diagnose the patient, what is the problem, how to recover that problem, what is the pathway of the disease, and then what stimulation you have to give. Then you can recover the patient in a better way. Otherwise, whatever you are doing is failure.
But can we still recover the?
You can recover all the patients. You can recover 85% in the clinic. Only 15% of the patients cannot be recovered. Otherwise, we have recovered the most critical eye disease in my life. Even my eye was lost by 80 to 90%. I recovered it. And now I lost it only because of my mobile phone, because I was doing my PhD in my mobile phone. I did not have laptop. Now I got the laptop. Otherwise, I did not have a laptop. And because of continuous reading in the mobile phone from last 5 years, I lost my eyesight by 30 to 40% or 50%. Otherwise,
Yeah, she can
75%
now
of
see.
the eyes.
She can only see her hands. And
But then you can recover this patient. But how to recover? By that
yeah,
map?
that's my problem.
Yeah, that's not only a problem. It is a problem of everyone.
And
Because
I want to learn.
Even if you learn, you must have some. Must have savings to start this infrastructure. By learning, it will not do. See, if I know surgery and if I don't have laparoscopy machine, can I do laparoscopy surgery?
No.
If I don't have the knife, if I don't have the OT room, can I do a surgery in my clinic?
No.
So where is the pain for recovery? Where is the stimulus? Where is the starting stimulus? Can you come with the ticket of Philippines to Guwahati? No, not possible. You have to go from different areas to reach here. You must have that money to buy the infrastructure. You must have that stimulus to produce in the brain, which produces appropriate results, which gives stimulus in the retinal cells, which gives blood circulation in the eye. You have to improve the total eye. You have to improve the brain, the most complicated thing of the mind you have to do. And what did you do? You just took a muscular pain and you stimulated it, and then you said, oh, I should improve. And you do it for 100 years also, it will not recover. Even your grandchildren cannot recover with this method. And there is no treatment of this patient in the whole world. So,
I plan
if you
to
want
bring
to
her.
recover,
Yeah.
even if you plan to bring her there, even if you plan to bring her in the Philippines, we cannot recover because the patients in Philippines, they don't pay us anything. We don't have infrastructure to recover them. It is a free camp. Yeah, I can teach you something, but it's a free camp. In free camp, how much we can support these patients? You may bring, I can teach you something, but since you also don't have that pain, how will you stimulate the pain and how will you recover the patient? That you have to think. Because no one can do in the world. This I can guarantee. Even if you send the patient to America, they cannot recover. Even if you send the patient to the best ophthalmic neurosurgeon, that also cannot do it. Because no one has studied the brain so closely. They do not know how to revert the damage of the brain. Everyone thinks like Dr. Chu, that if there is a damage inside the brain, it cannot be recovered. And we say, you can recover any damage inside the brain, only provided the pathway is created. And you can do that easily in the best possible way. But you must put a right signal.
Yeah, right. Actually, I plan to bring her to the camp. I already bought the plane ticket, but then because of this COVID, it's not pushed through. So I just stopped the
No, madam,
treating her.
I can understand this, but no. I'm asking you two questions. After I treat the patient for 4 days, who will follow up with the patient? Do you have 3 or 4 pains which work with the brain and the nerve and the stimulation of the eye? Do you have those infrastructures?
What infrastructure do you mean, Doc MK?
See, when I mean the infrastructure, I mean about the pain. There are different stimulus produced by the frequent pain. One pain cannot.
But she has no pain. She has
pain,
no pain.
No, not this pain. Pain.
I
Pen.
Yeah, I have the pen.
Which pen you have? Yes, which
From
pen?
you.
You are such a stupid person. I repeated again and again. That pain is
I'm
only.
sorry, but
Hear me.
I'm sorry, but
you hear me.
Pen.
I say about the acute pain. You have that acute pain only to recover the muscle.
I have the AcuPen from you.
Hear me. Hear me. Just shouting will not help you. Hear me what I'm saying. See, when I'm speaking about the acute pain, they have various categories and classifications. The acute pain which I gave you is only a basic acute pain which helps you in only paralysis and some brain damages. Even if you have a deeper brain damage, you cannot recover with that pain because that pain is not an advanced pain. It's a basic pain you have.
I see.
You cannot work with this brain with the eye damage and the visual cortex, because those stimulus which is required by the eye damage and the brain damage is different. For example, I am an Indian a person who's taking a vegetarian food. Can you give me a chicken to eat? Not possible. But since you have given me chicken, what I will do? I will not eat. Similarly, the brain stimulus provided by that pain cannot recover the disease. So you must have around 7 to 8 pain or 10 to 11 pains to work with your clinic. All
Sir,
this
it
pain
is.
must have its own stimulus.
Sir, can I interrupt you for a minute, sir? Chandrakant.
I know speaking Chandrakant.
Chan-
Yeah, please
Chandra-
speak Chandrakant.
Sir, this is not that we want to practice on those patients and recover them, but we want to help these patients. Suppose in case, like you saw Dr. Nageshwar Rao, who had lost his
No,
vision
1 minute.
with the
1 minute. No, 1
tumor.
minute. No. Let us classify one question at a minute, right? You want to help this patient. I am ready to train to you with this patient. But where is the infrastructure for the brain stimulation?
No, wherever you want, they can come also. That is another thing.
No,
It is
even
not that we
no.
want to recover.
No. One thing. No. Question is that do you think these patients can recover in 1 month or 2 months?
No.
It
Even
takes
if
1
takes
year to
time.
2 years to
No.
recover the eye and the brain.
No. If in case
See,
if you
that is
say
what
that
I
every
say.
month, if you call them
No.
somewhere also, they don't mind coming.
No. The question is that every month they can come for 5 days, 10 days, or 15 days, right?
Yes.
Can they stay 365 days? Can
No
they
problem.
stay 725 days?
Yes,
See,
sir.
it is not possible.
For them, I am telling you.
No. Chandrakant, try to understand me. This is not something which I say is not possible. You must train the attendant of the patient how to stimulate the brain. It's a very easy thing which they understand, that they can do it at home. Why you need to bring the patient and put a headache on you and the headache on the patient?
Okay.
Why don't you give, they supply them these pains properly? Let them buy these 4 or 5 pains, 6 pains.
Okay.
Train them
Okay.
for 1 month or 2 months. And topic is over. They can treat their own patient. 80%
Oh, now
of the
we got
people.
you. Now we got you. No, it is best is the patient attendant who can actually give the stimulus with the pen supplied by you.
Yes, that is what I say. Whatever pain is required, whatever stimulus. See, why you need to my pain? Because the question is that I studied the brain. You did not study the brain.
Because
I understood what stimulus is required. See, the question is not about you. It is the question about the whole world.
Yes. It is just like
The
how we
question
are
is that-
fighting with the coronavirus, sir. Now everyone wants to do help something virus, but no one knows how to do it.
It's the same thing. When I'm saying how to do it and what are the signals required, there is no one in the world to ready and come and learn this. Everyone is doing like the same lady. 1 minute, Chandrakant. Everyone is doing like this Philippine lady. They say, Sastry ji, I have that acute pain. I ask, Acha, which brain mapping you use? Or the one Dr. Danilo has sent. You do not know what is the damage inside the eye, what is the damage inside the brain, how much stimulus you have to give, where you have to give, which pain is required, what amount of voltage you have to transfer inside the brain. You know nothing. You just take the pen and you put the brain, and I don't know what the brain will understand, what you will understand, what the eye will understand, and I don't know what is the outcome. You are saying something in the Kannada, you are saying something in Malay language, or you are saying something to a Filipino. To me,
They won't
what will
understand.
I understand?
Nothing.
It's the same thing. To speak to me, you must speak to me in the English language, right?
Yes.
Right.
So that English language, your English language and my English language should be same.
Yes.
And that effort you must take to learn the English language. The learning of that English language is the stimulation of the brain. So you must know which pain will give this stimulation. How much signal has to be given? What is the voltage? How much voltage has to be given to be transferred? But the problem with us is what you know. We take one pain and we try to recover the entire brain. We try to recover the entire eye. And then I say, my seminars are what you know, is just a joke. People come, they come and enjoy. It's a movie show. But so far their recovery is concerned, no one can recover a patient. Because I asked people, how much pen did he buy? What pen did he buy? Say, he did not buy anything. Oh, what did he do? He do nothing. Go home. It was a very good movie. You understand? First question I ask people, how many people bite the pen? Sir, no one. Okay. How many people are interested to buy the pen? Sir, only 3. Very good. How many people? 4. How
You
many
have
pen
to
you
make,
buy?
you no, one thing I also request you, sir, you have to make some things mandatory. You should not
See,
keep
one
them
thing
voluntary, because unless you make them
Chandrakant,
mandatory.
no. Chandrakant, one thing I tell you. You make it voluntary and what people will say, you know? When I went to Philippines, what people said? When I went to Malaysia, what people said, you know? You
That
ask
maybe,
Malaysia,
now
you ask
that
them.
when they don't understand you properly, sir, once they understand you, we
So why to
know
make them?
the,
No. See, you want to recover a patient in your clinic. I explained you everything. Now, if you don't want to recover, don't recover. What is my problem? Why should I force you to recover your patient?
ultimately you make us recover the patients because we are learning and we have to know.
Yeah, I want to recover the patient. I bought
But
one pen and you gave me one, so I have 2 pens only.
So 1 or 2 pen cannot recover the patient. You must have the brain stimulation. These are specialized techniques. You are working with the most complicated area of the human body, the brain, the heart, the nerve, the stimulus. You are working in that area of the brain which no one can recover in the whole world. Even the Harvard University, after having a non-invasive brain stimulation of such a big infrastructure of spending how many dollars? Around 500,000 American dollars or 1 million American dollars if they spend, they create this infrastructure. And after having that infrastructure also, they cannot recover your patient. You go to Harvard University, you go to Yale University. Why Yale University is running after me? And why I'm not going to Yale University for my postdoctoral? Why am I going to Stanford? I'm going to Stanford because no one knows me in the Stanford University. You know what is the problem of we people? Our problem is that we don't want to recover the patient. We just go with one story. We want to recover paralysis also with the same pain. We want to recover the eye problem also with the same pain. Not possible. That is why I said you are opening a stroke clinic without the infrastructure. So nothing is possible because see, you cannot force anyone to practice anything in the world. You cannot force anyone to learn anything. You imagine such an important class of non-invasive brain stimulation is going on. Out of 77 people, only 30 people are present. Out of 10,000 students, how many are present? 30. Now you tell me, how many are interested? Even if you see in my Zoom class, there are 236 people who have joined. 276. Out of 276, how many people are here today? It is a question of a free class. Then also people are not there. You imagine. So people don't want to recover. They just want to play around. I don't see any people recovering any patient. I saw the best neurosurgeon also in the world. I saw the best physicians of the world. All are just playing with the patient. I saw the acupuncturist of Shanghai University. I saw the acupuncturist of China. I saw the acupuncturist of Philippines. I saw the doctors of Malaysia. Everyone is same. People are suffering from 7 years and they continue to suffer for their whole life. Whose fault is this? Tell me. Why people are suffering from 10 years in paralysis? Why people are becoming blind? Why people have to wait for me? I have given 70 patients. I have treated 700 patients. These patients are not ready to come to any doctor even if I refer them. Why? None of my treated patients wants to take the second advice from a third doctor. Why? Because they believe they have lost faith in the medical science. Why they have lost? Because they know that they cannot recover.